It is my pleasure to have a very distinguished group of panelists on board. My name is Bert Hoffmann. I'm from the German Institute of Global and Area Studies and part of the GLACIER project, which we have already heard a bit about. And I will just be very brief in presenting our speakers because we have to run with time. It's 6 panelists. That is a lot of panelists. We have to try to be as concise as possible to have a Q&A opportunity afterwards. This panel will be about speaking about money, hablemos de dinero, financiación para la salud global. And it connects well to quite a lot of the themes we have been talking about in the previous sessions. So without further ado, let me just briefly present the panelists. We've got Katharina Fleckenstein with us from the DAAD, the German Service of Academic Exchange. And we have to give you a big, big thank you because the GLACIER project and this conference to a good extent is funded via the DAAD. So thank you at this point once again for that. Yes. We've got Olga Baus with us, jefa adjunta de la Unidad B2 de la Dirección General de Asociaciones Internacionales. You can say more about your position in the presentation. I will be brief. We've got next to her Belén García Codina, the coordinator of the Iniciativa de Salud de EU Latin America y el Caribe de la Fundación CSAI. También tú vas a decir más sobre eso, me imagino, en tu presentación. And then we have with us online Angela Hinz from CARPA, the Caribbean Agency for Public Health. Thank you very much for joining us. Can you hear us well?
Yes, I can.
And we can hear you very well. Wonderful. Welcome on board. And again, also online, we have with us tenemos con nosotros Alejandra Acuña Navarro, who es de la Secretaría Ejecutiva del Consejo de Ministros de Salud de Centroamérica. Hello, bienvenida Alejandra, ¿nos escuchas bien?
Muy bien, muy buenos días para mí y buenas tardes para ustedes.
Sí, bueno. And finally, we've got with us Willem Quintin, Profesor de Salud Pública y Planetaria de la Universidad de Bayreuth in el sur de Alemania. He is the coordinator of kind of a sister global health center of the GLACIER project, the GWAC, a global center on health with West Africa. Thank you very much for joining us here to bring in a different perspective. And that's also a bit why I'm switching the languages, because we've got non-Spanish speakers with us. Pero cada uno habla en su idioma que prefiere. Tenemos la traducción así, la mayoría entiende ambos idiomas. Without further ado, I pass the mic to Katharina.
And I'm supposed to explain a little bit on our funding mechanism since we're talking about money, I suppose. Yeah. Right. So, Bert, thank you very much for the introduction. I mean, I think most of you have heard about the German Academic Exchange Service, who we are, what we do. We are present with lots of offices in all over the world. In Latin America, we are being present with one office, a regional office in Mexico City, being responsible for Central America and the Caribbean. We are also present, we established 2.5 years ago or 3 years ago, like another regional office in Colombia, in Bogota, which is responsible for Venezuela, Peru, and Ecuador, and obviously Colombia. And then we have another huge office and also like a house of innovation and science and innovation in Rio de Janeiro and in Sao Paulo. And then we have 2 smaller offices in Chile and Argentina. So you can say we really have quite a wide network all over the country. And I think that's also kind of a bit in the future to make a lot of synergies in between topics. And so, of course, we are very, very looking forward to also listen from your side in which topics you're actually working in. And I think one of like the latest news that I can present here, apart from awarding scholarships, having like, funds for fostering interinstitutional cooperations in between Germany and foreign universities, we are right now in a process of obtaining a so-called PACAR status, which means like Pillar Assessed Contribution Agreement, which is like a status which we obtain by the European Union, which gives us like the possibility in the future to also do projects which are being funded by funds from the European Union. And in that sense, it's kind of like a task, unfortunately not for me anymore, but fortunately, and I think I also take this moment to present my successor, Christoph Hanse, to you, because I will return to Germany by the end of August, and Christoph will take over in November, our DAAD office in Mexico, and he will be your new contact person then. And Christoph has a lot of experience in all these kind of, European Union funded projects. So I think it's like a good start for him, because we are planning right now an event by the end of July to combine our activities, not only like in topics of health, but also in health, because we are kind of, we are orienting ourselves on the topics, on the key strategic areas of the European Commission, of the initiative of Global Gateway, which is health, the digital sector, climate and energy, transport, but also education and research. And I mean, like talking about our vast alumni network in Mexico, just in our database, only talking about Mexico, we have more than 6,000 people which have been working in the one or the other topic. And the idea is not only Germany, but obviously with our European partners, to kind of combine our forces and see really results-based what could be done in the future, and how we can also attract investors to see, to secure the funds eventually. So that's, pretty much what I can present in terms of news. And thanks again for inviting me.
Muchas gracias. Katharina, paso la palabra directamente a Olga.
Gracias. Sí, bueno, yo trabajo en la Comisión Europea, en la Dirección General de Asociaciones Internacionales, particularmente en el Servicio Geográfico que se encarga de Latinoamérica y el Caribe. Yo en particular llevo las relaciones bilaterales de Caribe, Centroamérica y México, pero llevo los programas regionales en cuestiones de salud. Y es más de este lado que estoy aquí. Yo os querría hablar un poco del Global Gateway, una clase en 5 minutos. Va a ser un poco difícil, pero lo intento. Ya se han presentado los sectores en los que trabajamos, pero antes de empezar a ir más en los detalles técnicos, querría mencionar que el Global Gateway es una estrategia que sale a finales de 2021 porque se realizan, se ve de un lado con la pandemia y los conflictos actuales, se ve que las dependencias son muy asimétricas, y del otro lado nos damos cuenta que con la ayuda oficial del desarrollo no podemos combatir estos retos que tenemos como humanidad, que son muy complejos y caros, como puede ser el cambio climático o la salud global. Es la visión del Global Gateway, es decir, queremos conectarnos con el mundo y con nuestros socios de una manera diferente para realmente poder tener un impacto transformativo y no quedarnos con lo que es el proyecto tradicional de ayuda, el donor recipient, sino ir más allá y pasar a lo que son realmente asociaciones con los países que quieran colaborar. En el mismo tiempo, por ejemplo, la dirección general donde trabajo era la Dirección General de Desarrollo, y se ha cambiado el nombre de una manera simbólica para realmente demostrar que lo que queremos es otro tipo de relación y otro tipo de trabajo. Si tuviera que resumir el Global Gateway en 3 palabras, diría la primera: buscamos transformación real en las sociedades. Entonces, queremos colaborar en iniciativas que sean ambiciosas, y son iniciativas en las cuales hacemos un esfuerzo para trabajar con todos los Estados miembros. Queremos adicionalidad, entonces queremos realmente trabajar con los países terceros, pero a nivel de socio, y necesitamos movilizar con nosotros el sector privado. Y la tercera palabra que yo pondría sería resiliencia. Queremos inversiones que sean cualitativas, que lleven estándares sociales y de medio ambiente que hagan que cualquier inversión de infraestructura sea sostenible. Lo que se intenta es poner en la misma línea cooperación, financiación e inversión, en donde la innovación y la transferencia de tecnología es parte primordial de esta cadena. No lo hemos hecho nunca esto, ¿eh? Si vais al terreno encontraréis que los cooperantes hacen sus proyectos, que las empresas llegan y hacen su negocio con ayuda de los ministerios de comercio de los Estados miembros, y que los bancos de desarrollo se suman al primer proyecto que es bancable. Y entonces tenemos una fragmentación como Europa, tenemos una fragmentación muy grande. Lo que intenta el Global Gateway es poner esta fragmentación en una misma dirección con un mismo objetivo. Y ahora entro en cómo lo hemos trabajado para Latinoamérica y el Caribe. Hubo perdonad que a veces me salen en inglés las palabras, hubo la cumbre de la Unión Europea con la CELAC el pasado julio de 2023 y allí se presentaron 130 iniciativas en las cuales la Unión Europea y sus Estados miembros se comprometieron a movilizarse políticamente para que las inversiones y los diferentes instrumentos de ayuda vayan hacia estas iniciativas. Son iniciativas, la mayoría bilaterales, que han sido concertadas con el Estado tercero. Hay iniciativas para todos los países, más o menos son 2 o 3 iniciativas, más una serie de iniciativas regionales, entre ellas, por ejemplo, la iniciativa de salud, que aquí ha sido mencionado. Hubo el primer impulso político en 2022 por la presidenta van der Leyen y el presidente Sánchez de España. Entonces, de esta lista, que la podéis consultar, que está publicada, hay 8 países que han puesto salud y lo que es la producción de medicamentos y vacunas como prioridades. Entonces, desde las instituciones y con los Estados miembros, lo que estamos haciendo es movilizarnos para realmente apoyar en estos países, porque es allí en donde los socios nos están diciendo: queremos trabajar con vosotros. Os los nombro. Tenemos Barbados y Guyana y Cuba en el Caribe, México, Costa Rica, Colombia, Ecuador y Panamá. Estos son los que individualmente quieren invertir en salud y quieren colaborar y quieren hablar con nosotros de estas cuestiones. Y luego hay la iniciativa regional. En la iniciativa regional se enmarca en esta iniciativa lanzada por van der Leyen, pero se alinea claramente a lo que es el plan de autosuficiencia de la CELAC. Estamos completamente alineados. Hasta ahora, a nivel regional, ha costado mucho fomentar lo que es el diálogo. Hemos puesto en marcha una serie de plataformas colaborativas. Ha habido 2 diálogos birregionales de alto nivel. Hubo uno en 2023 en donde se discutieron prioridades, la transferencia de conocimiento y las oportunidades financieras. Ha habido uno en marzo este año. Se ha discutido más lo que es el acceso equitable, cómo podemos incentivar la regulación armónica y cómo se puede fomentar la cooperación triangular, incluido con África. Hemos hecho también un evento con todas las instituciones reguladoras del Caribe sobre cuestiones regulatorias subregionales, y hemos hecho también un evento a alto nivel en Centroamérica que se focalizaba más en cuestiones de innovación farmacológica. Cada tema es dependiendo de lo que vemos que el socio nos va poniendo en la mesa. Y estoy muy de acuerdo con no sé quién de los paneles anteriores que dijo que los políticos responden a los movimientos de la población. Y los ciudadanos somos todos, no somos solo las instituciones, sois los académicos, es todo el mundo. Entonces, yo lo que sí que veo ahora desde mi posición es que hay un movimiento para movilizarnos y igual encontrar estas prioridades a nivel regional que se están identificando. ¿Qué hacemos más? Estamos fomentando los intercambios a nivel sectorial. Hemos puesto como prioridad de lo que es la hoja de ruta de la colaboración en cuestiones de investigación entre la Unión Europea y la GLAC, salud. Salud es una prioridad de esta hoja de ruta, entonces los próximos calls que van a salir para Horizon Europa, salud va a estar allí. A mí lo que me interesa es escuchar en estos tipos de eventos cuáles son las preocupaciones reales, porque yo puedo influir en las prioridades que se ponen en el call, pero necesito saber dónde se quiere incidir. Por eso es importante ver lo que se está buscando. Y luego estamos iniciando lo que es una plataforma de intercambio con la industria biofarmacéutica. Se hizo la primera mesa redonda sobre estas cuestiones con la industria cuando hubo la cumbre en el 2023. Se hizo un matchmaking event en marzo del 2023 para que la propia industria busca colaboraciones a nivel transatlántico. Y el viernes pasado, la semana pasada, estábamos en un evento técnico en donde había industria latinoamericana y caribeña y también europea. Fiocruz estaba allí, por ejemplo, en donde para nosotros es muy importante ver dónde hay realmente tracción para poder pensar en colaboraciones futuras. Y ahora paso más a cuestiones más de proyectos. A nivel de proyecto, lógicamente con el presupuesto de la Unión Europea se fomenta proyecto un poco del tipo tradicional, pero lo que queremos es que estos proyectos catalicen y movilicen inversiones posteriores de diferentes otros actores. Os mencionaré rápidamente algo que tenemos. Tenemos un proyecto de partenariado con la FAO a nivel continental, en donde estamos fomentando la armonización de la regulación, las capacidades locales de producción y el transfer de tecnología. Estamos este año adoptando un proyecto de 9 millones específicamente para el Caribe, PharmaNext, porque las necesidades de desarrollar todo lo que es el sistema regulatorio y la capacidad manufacturera y de innovación es mucho más importante en el Caribe. Y estamos apoyando con los programas bilaterales a los países que nos están pidiendo estar en salud. Tenemos, por ejemplo, con COFEPRIS en México, tenemos un proyecto de 1,5 millones. Con Cuba tenemos 8 millones que se están invirtiendo para mejorar los estándares de la producción de medicina en la planta de Mariel, etcétera. Y luego lo que estamos haciendo es poner en marcha nuevos instrumentos dentro del marco de lo que llamamos el EFSD+, que es el Fondo Europeo de Desarrollo Sostenible, en donde estamos colaborando con los bancos de financieros. Tenemos ahora en la mesa, tenemos 2 proyectos los cuales podrían ya apoyar a inversionistas, 2 en cuestiones de salud. Uno es con el BEI y con la Fundación Bill Gates. Nosotros lo que aportamos es el first loss, son las garantías para que haya inversiones de riesgo. Tenemos 20 millones de garantía para desarrollar algún proyecto en producción de vacunas o de medicamentos. Y tenemos otro que es con Cardano, que se llama First Mobile Health Investors, que hemos puesto 7,5 millones de garantías que seguramente van a movilizar unos 100 millones de inversión, porque se trata de inversiones mucho más a nivel tecnológico, los cuales Cardano que Cardano considera que hay menos riesgo. Nosotros lo que hacemos una vez los instrumentos están sobre la mesa es poner en contacto la industria que quiere hacer una inversión con los financieros para que ayuden a desarrollar de una manera bancable el proyecto. Entonces, si alguno tiene en mente alguna de estas inversiones, podéis pasar por nosotros y nosotros os ponemos en contacto con los financieros. Y luego lo que también estamos haciendo es dar créditos concesionales. En el Caribe, por ejemplo, a través del BEI tenemos una línea de crédito que ha dado 75 millones y que esperamos poder seguir dando. Se ha invertido más en esas líneas de crédito, son créditos soberanos y se invierte más en la resiliencia de los sistemas de salud, hospitalario y este tipo. Y finalmente lo que hacemos también es hacer algún blending a operaciones específicas. En Cuba, por ejemplo, estamos haciendo un blending ahora de 8 millones para un crédito de 25 con la EDD, que es la agencia financiera francesa, para que Finlay pueda escalar la producción de las vacunas de medicamento a 50 millones de vacunas, con el objetivo también que tiene Finlay de tener colaboraciones con África. Y veo que me vas a cortar, me corto yo misma. Quería solo señalar que lo que es el Global Gateway, yo lo que veo es una oportunidad de repensar la manera en que trabajamos todos de manera conjunta. Y estamos intentando desde las instituciones fomentar plataformas en donde haya estos intercambios. Es bastante difícil, estamos en nuestros inicios y estas plataformas, se ha hablado también de confianza en los networks, pero cuando tú tienes plataformas en donde trabajas con el sector privado, es realmente difícil. Entonces son plataformas que son colaborativas, pero que sabemos que son competitivas, porque están en competición. Entonces hay siempre la cuestión de la confidencialidad, de que la confianza. En un año desde que estamos trabajando en este sentido, yo veo ya una diferencia y espero que esta transición nos lleve a tener resultados mucho más ambiciosos. Gracias.
Muchas gracias, Olga. Creo que ha sido un panorama bastante comprensivo, pero también bastante concreto. Creo que nos llevamos a una mucho mejor idea de lo que hacen que muchos hemos tenido antes. Muchas gracias. Y creo que si usted busca, si necesita saber las prioridades, creo que también en ese día ya hemos dado algunas ideas de involucrar las comunidades que mencionó Juan Carlos y prevención. Y bueno, sí, espero que también lleve algunas ideas concretas de ese día. Bueno, paso la palabra a Belén García.
Thank you. Good afternoon, everyone. Buenas tardes a todos. First of all, I would like to thank the EU-LAC Foundation and the German Latin American Center for Infection and Epidemiology Research, GLACIER, for organizing this discussion space and for thinking of me to participate in this important event that seeks to strengthen the ties between European Union and the Latin America and the Caribbean region. Well, I'm going to speak about the EU-LAC Health Alliance, which aims to support the strengthening of the regulatory systems for medicines, products, and vaccines, as well as the production and equitable access at the regional level. As you everything knows, in September 2021, the Community of Latin American and Caribbean States presented a health sufficiency plan approved by all the member countries. This plan continues to guide national, regional, and collaborative efforts with the European Union and the member states, and contain three key dimensions: the strengthening of regulatory frameworks, the promotion of private investments in the health sector in Latin America and Caribbean region, including support for a favorable business environment, and research and development, including technology and knowledge transfer. In June 2022, Ursula von der Leyen, as President of the European Commission, and Pedro Sánchez, as President of the Spanish government, launched a proposal to develop a Team Europe initiative to promote the production of vaccines and health products in Latin America and the Caribbean. This was in a context still marked by the COVID-19 pandemic. In the joint declaration of the 2023 EU-LAC Summit, the heads of the state and government expressed their commitment to advance the regional partnerships for the local manufacture of vaccines and to improve prevention, preparedness, and response to public health emergencies in support of the CELAC health plan sufficiency. Well, looking into the future, in the second semester of 2025, Colombia will host the next EU-LAC Summit, which will provide an excellent opportunity to demonstrate the strong commitment of both regions to equitable development in this sector. This will be even more relevant considering that President Gustavo Petro recently presented the priorities of the Colombian presidency of the CELAC, among which is the joint production of medicines. In addition, Brazil is promoting under the presidency of the G20, the Alliance for Local and Regional Production and Innovation, focused on access to vaccines, treatments, diagnostics, and other health technologies, and with a focus on neglected diseases. In this favorable context, the Spanish government and the European Commission are seeking other EU member states interested in establishing a TEI partnership with Latin America and the Caribbean in this field. The aim of these partnerships is to promote equity in access to healthcare by boosting research, production, and equitable uptake of vaccines, medicines, and health technologies in Latin America. For the last year, it's important to mention the Spanish Agency for International Development Cooperation and its implementing partner, the CSAI Foundation, have been developing a pilot project to identify the key elements to create a TEI to promote the production of vaccines in the region. The first phase of this project was funded with €500,000, and the budget will be extended in 2025. In order to define the goals of the initiative, consultations have been held with Latin American and Caribbean countries, PAHO, EU member states, civil society, private sector representatives, and other stakeholders operating in this ecosystem. On top of that, a regional diagnostic is being finalized, which will serve as the basis for the next phase of the project, oriented around 5 pillars: the regulation, innovation, investment, production, and equitable access. Throughout the first phase of the project, 3 main objectives have been identified: developing a regional system for the homologation of medicines, fostering a regulatory framework that allows for public-private investment in the regional pharmaceutical industry, and the third, R&D, promoting the R&D, including technology and knowledge transfer. From the 21st to the 23rd of August 2024, PAHO is organizing a regional event on the Pan-American Network for Drug Regulatory Harmonization to strengthen equitable access and converge in this issue. This event will present a potential opportunity of the Team Europe initiative and how it can contribute to achieving this goal. Finally, the European Commission and the government of Spain invite other EU member states to join and develop a common agenda that can be presented as a flagship initiative during the EU-LAC Summit in 2025. The aim is to build on existing expertise and funding efforts to catalyze a high-impact initiative that can contribute to building more resilient supply change, enhance the open strategic autonomy of the regions, and promote equitable access to health products and technology in the LAC region. Thanks.
Okay, thank you very much, Benny. I think without further ado, I would pass it now to our online speakers. Angela, and the floor is yours.
I'm sorry, we could hardly hear online. I think you called on me?
Yes, yes, yes. And you cannot see me. I'm calling on you. I will give it the floor.
Okay.
I forgot to turn on the mic, so that was easy.
Okay, no problem. All right, so I'm Angela Hines. I'm head of Health Information, Communicable Diseases and Emergency Response at CARPHA, Caribbean Public Health Agency. I thought I should just give you a brief outline of who CARPHA is and what we do. We're a public health agency, and we have 3 locations, one in Trinidad and Tobago, one in St. Lucia, one in Jamaica. And we have we generally cover a very wide range of activities. We do non-communicable diseases and obesity and injuries, surveillance, communicable disease, including HIV, surveillance, laboratory services and networks, regional health security, environmental health and sustainable development, tourism and health, foodborne diseases and food safety, vector-borne diseases, medicines, pharmaceuticals, testing and regulatory monitoring, health research, emergency response, and climate change and health. And also we have a field epidemiology lab training program. And I tell you all these because we have 26 member countries, mainly the English-speaking countries and the 3 Dutch-speaking countries. And as you would know, in the Caribbean, it's a wide range there. Range in terms of GDPs, range in terms of size, range in terms of population. So you can get a smaller population, let's say 1,000 plus people, to almost 2,000 on a good day, to about say 3.9 million or 3.7 million in Jamaica. Haiti is also one of our countries. But because of what has been happening, we haven't been able to service and do as much collaboration as we would usually do. We have 3 laboratories. One in Trinidad is a medical microbiology lab. The other one in St. Lucia is environmental health lab, and the one in Jamaica is our medicine quality and control lab. And so just to give you an idea, so what we are a CARICOM organization, so we fall under the Caribbean Community umbrella. And so we offer a wide range of services, recognizing that within our countries, because of the small populations, you may not always have the skill sets available, as well as there's high turnover, there's low GDP, and sometimes depending on the climatic conditions, because as you know, it's a hurricane-prone region, we are there for, and earthquakes also, we are there to help with respect to emergency response. And of course, to provide any training. We do not give funds. However, we do actually seek funding for our member states to assist them in any area within the public health sphere that they do need help. We work with a lot of organizations within the region, such as Pan American Health Organization, of course, CDEMA, which is our disaster emergency management organization, the Organization of Eastern Caribbean States, and a number of other regional entities, especially those that fall under the CARICOM umbrella that we will work with. We Generally, in terms of collaborations, we do a lot of collaborating with the tourism, academia, security sector, business, education, governance and policy formulation, as well as communication with respect to the media. And then to just give you an idea with respect to our budget, we are generally most of our the contributions that we do get from countries is spent on HR, the core staffing, and some core operating expenses. After that, all our money is from our IDPs. And that constitutes at times about 56% to 60% of our budget, which is, say, in 2023 was a 12.8 million. So in terms of our public-private mobilization initiatives, we generally try to secure funds to do activities in terms of building systems and capacities in our countries, facilitate those relationships with other countries or communities with similar challenges of like ourselves, or provide technical expertise to either through our IDPs via exchanges, in both ways, either persons from the region going out or people external coming in, or providing consultancy related services for those particular expertise that we don't have in the region or not available to country that the country needs. We try to institute a lot of collaborations with our learning institutions, be it within the regional universities or external, with respect to other IDPs, other external international universities. And then, of course, we do get a lot of support. We do have what we call our overseas territories, which would be there are 5, I think, UK territories, for which we would work with the UKHSA with respect to supporting those countries, as well as we have Dutch territories, and we do work with the Kingdom of the Netherlands to support activities going on in those countries. And most of the information is in terms of sustainable health and health systems, structures, policy, building, etc. In terms of we do have a lot of instruments or mechanisms by which we work internationally, regionally, and country to country within the countries. They're often MOUs that countries would do to supply certain services. So, for example, you may have 3 countries who share the person to do autopsies. You may have we have regional institutions that do have special arrangements with countries, and that would be like for CDMA, ourselves, CAFA, PAHO, OECS would there would be special country specific ways in which they will work, as well as you would have regional institutions working with other regional institutions. And those regional institutions will work together. So CDMA will work with OECS, who will work with any of the other activities. We have multilateral, of course, institutions such as IDPs, which would be external, but more specific to the European. We have Spain, through the AEIC. EU, UKHSA, and AFD, and a number of others. Also, we have the banks, the IDs, and other international institutions, of course, like the UN family, as well as the etc.
May I interrupt you?
In terms of
May I interrupt you briefly?
I'm here in the Spanish translation. Is it disturbing you all? Sorry. Is it okay?
We had excellent voice.
Audio? Okay, great.
And audio for a long time, but the last minute was kind of difficult. I don't know what's, maybe it was a translation or maybe there was something disturbing your connection.
Yeah, I was getting the Spanish translation fairly loudly, so I wasn't sure if it was bothering you all.
Okay, it's better now.
Okay,
Yeah.
it's better now. Okay.
Go on.
So with respect to the I mean, the other initiatives that we really want to look towards this group and finding ways in which we can work. And one of the areas which, of course, we're working with is climate change, because, of course, we are a fair number of small island developing states, as well as we do have, like, say, for example, Guyana, whose coastland is under the sea level. So, of course, climate change is of concern to them too. And so we are currently doing with PAHO and the other universities doing modeling with respect to climate and predicting outbreaks of dengue. And we're looking to do other types of climate change related studies. There's the development of resilient health systems, because given our small tourist dependent countries who have who are short of some of the technical resources needed, we need innovative approaches in which to do and to provide healthcare and health systems within countries. We do need to really expand and integrate systems so that you have real-time digital systems. We do want to work in the area of research initiatives, which should be guided by the regional research agenda, which CARICOM usually leads and identifies those spaces. We want to support institutional training and or exchange opportunities, because as you would realize, we have such a high turnover. They're small countries, they don't necessarily have all the resources, and we do want to really support that space. And through our FELTEP, which we are always looking to partner to, we have a level 1 and level 2, and we really would like to move to a level 3, but we would need the academic institution to work with. Also to capacity building in terms of with January, and I can give an example with respect to the lab, next generation sequencing we'd like to do, or even volunteering to be part of validation of new laboratory related techniques, because we do have a fairly substantial, I'm saying the word substantial, of course this is all relative, but we do keep our specimens and they are available for institutions who would like to test some of their new related techniques.
Could I ask you perhaps to come to a close, that we have some.
Yes. And so this is the last thing I want to talk about, and those are some of the gaps. There's something that sometimes not all the countries are eligible for international resources, mainly because of their small size and seemingly that their GDP is high. So that still is a problem. They still need that technical expertise, and sometimes there is a lack of support for human resources in small population countries when it comes to funds that are available. And there is that lack of available funds for chronic disease and injury related activities. So that's it in a nutshell for me. Thank you very much.
Okay, thank you very much, Angela. Very interesting. And I think it's amazing because we have the EU-LAC bridge and you have it in your very own organization. If you cater to Dutch islands and to the bridge overseas territories, so there's quite some Europe, Latin American, Caribbean within your reach. Can't we do it afterwards?
No, sorry, Angela. Hi, Felix Rex from Charité. I have a couple of questions and I cannot wait because I'm too curious. First question.
I can answer them.
Yes. First, I'll try to be succinct so it's easy to answer. First of all, you don't mention Cuba as a part of CARPA. What kept you, what is keeping Cuba as the biggest Caribbean island from being a member? Because they are in CARICOM. So it's not like they are excluded from the collaboration. 1. 2, what about inclusion of the continental Latin American countries that have a Caribbean coast like Mexico, Colombia, and Venezuela? 3, who is funding you? Thank you.
Those are very hard questions.
Okay, you have a minute and a half.
I really, actually, in terms of collaboration with, say, the Latin American countries, and I will include Cuba and those other countries that border the Caribbean, we actually liaise with them through PAHO. So we do a lot of cooperation with those countries through the Pan American Health Organization. And why they are not part of ours, that one I can't answer, but I could get back to you on an answer with that. With respect to funders, our funders range from the CDC, the PAHO, but as far as Korea, Spain, England, of course, quite a number, but more specifically, actually, which I didn't mention, we do have an actual private sector arrangement with respect to, because we're a tourist dependent country, islands or region, we do have specific what we call tourism surveillance program, which I don't want to go into now because it will take too long, but we have a very heavy connection to the cruise ship industry and the hotel industry within the islands. And the question was, there was one I missed. Yeah.
One was on the big countries like Mexico, but we leave that for the later discussion. I think I would like to pass it on to Alejandra. Damos el salto hacia Centroamérica, cambiamos el idioma un poco.
Bueno, muy buenos días.
Adelante, Alejandra. Muchas gracias.
Muy buenos días a los que estamos de este lado y buenas tardes para ustedes allá. Bueno, yo quiero comentarles muy rápidamente qué es el COMISCA y qué es el SECOMISCA, y creo que esto es importante dejarlo también claro. Dentro del sistema de integración centroamericana se establecen 11 secretarías, donde reúne a las autoridades políticas correspondientes. Una de esas secretarías es el Consejo de Ministros de Salud, que se reúne 2 veces al año o 4 veces según ellos lo definan si hay algunas reuniones extraordinarias. El Consejo de Ministros de Salud es el responsable técnico de el proceso rector en materia de salud a nivel del SICA y es quien define las políticas de salud a nivel de la región. Por supuesto que eso es apoyado por una secretaría, que somos nosotros, y en mi caso yo como secretaria ejecutiva soy la que llevo toda la agenda política de los ministros. Nosotros tenemos por delegación de los ministros de salud las competencias de articular todo lo que corresponde a esas prioridades políticas. En este momento puedo decirles, y creo que esto es importante según la discusión incluso del panel anterior, que me di a la tarea de conectarme para poder escucharlo, tenemos vinculación política. ¿Qué significa esto? Que las decisiones que firman los ministros de salud en Centroamérica y República Dominicana son vinculantes. Ellos, una vez que firman una resolución, tienen que ejercerla y cumplirla en sus estados miembros. Esto quiero aclararlo porque el mantener en la agenda política un tema tan importante como la atención de las pandemias o las epidemias está precisamente en este momento en la agenda política de Centroamérica y creo que es importante rescatarlo. Parte de eso es donde entonces nosotros movilizamos una serie de recursos financieros. Somos, aparte de este proceso de articulador de la respuesta regional, somos también un mecanismo implementador de proyectos de cooperación. Dentro de eso, hemos desarrollado una serie de memorándum de entendimiento con algunas instancias regionales, por ejemplo, con SISCA, que es Sistema de Integración Sistema de Integración Social, donde tenemos una colaboración de un gobierno y que con esa colaboración desarrollamos procesos políticos regionales, por ejemplo, en materia de regulación sanitaria y en materia ahora que incluso mencionaron a COFEPRIS. Hemos tenido también desarrollos de acciones específicas con COFEPRIS. Dentro de esos memorándum de entendimiento también tenemos algunos socios de cooperación técnico-financiero como es el Centro del Control de las Enfermedades, CDC-CAR, que tiene su oficina, y yo creo que ahora lo mencionaron también, tiene una oficina precisamente en Guatemala y otra en Panamá. Con ellos tenemos un acuerdo cooperativo, el proyecto de salud global, que cubrimos prácticamente gran parte de las acciones para atender salud de la frontera, formación de epidemiología de campo, control de infecciones, reglamento sanitario internacional, bueno, vacunas, dándole énfasis a zonas con graves dificultades para cobertura de vacunas, como es Belice, Guatemala, que por sus poblaciones cuesta mucho entrar, entonces se contrata personal y ahí se llevan esas acciones. ¿Qué quiero decir con esto? Que tenemos cooperantes que según las prioridades políticas definidas, hemos realizado convenios y con ellos desarrollamos una serie de acciones. Tenemos también, y creo que esto es un proceso importante a contemplar, que es utilizar mecanismos establecidos para lograr una utilización de recursos con eficiencia. Aquí puedo darle como ejemplo, durante la pandemia, los presidentes establecieron un plan de contingencia. El primer eje del plan de contingencia fue salud, la atención en salud, y ahí se hizo una utilización de los recursos que ya estaban destinados para apoyar a los Estados miembros, pero bueno, una redireccionalidad a productos específicos que se requerían de parte de los países para la pandemia. Puedo mencionar el ejemplo de los fondos de la Unión Europea, el Fondo España-SICA y del Banco Interamericano de Desarrollo, que utilizó un mecanismo que tenemos como marca registrada que se llama negociación conjunta con MISCA. Y quiero dejarlo acá también explicado porque este mecanismo de negociación conjunta con MISCA permite a los Estados miembros negociar a la baja con empresas farmacéuticas compras de medicamentos e insumos de laboratorio y equipos de protección personal, por ejemplo, como en pandemia. Eso permitió ahorros significativos y reinversión de ese dinero en otras prioridades políticas. Y creo que esto es importante. Seguimos utilizando el mecanismo de negociación conjunta con MISCA y bueno, ha sido de las prioridades políticas que los ministros nos han planteado. Recién acabo de terminar la reunión de ministros la semana pasada, miércoles y jueves, por eso no pude viajar y acompañarlos a ustedes de forma presencial, pero creo que esto es importante establecerlo. Son mecanismos que tiene la región centroamericana, que incluso en este momento se nos adhirió Ecuador como un país más que utiliza el mecanismo de negociación conjunta con MISCA y que se está ahorrando cerca en este momento, por ejemplo, Ecuador, cerca de $2 millones en la compra de algunos medicamentos que se acaban en el proceso de negociación que se acaba de terminar. Y como estamos hablando de financiamiento, quiero, digamos, dejar claro esto, porque son mecanismos que permite que con recursos frescos del Estado se puedan volver a reutilizar. Luego, el tema de la promoción que normalmente mantenemos con cooperantes financieros, de presentar propuestas regionales que si bien vienen a fortalecer acciones nacionales, pero que desde el enfoque regional y desde la decisión política que tenemos, nos es más fácil presentar y articular esas acciones regionales. En este caso, acabamos de presentar, ustedes lo saben, está lo del fondo pandémico, pero acabamos de presentar otros también a España, de manera que esperamos que con esto podamos seguir fortaleciendo las capacidades a nivel de la región. Tenemos uno muy interesante también presentado al Centro del Control de Enfermedades que nos está permitiendo también fortalecer esas acciones específicas que les venía diciendo de salud de fronteras y atención de emergencias sanitarias, con apoyo también de la Organización Panamericana de la Salud, que es un socio más de tipo técnico que financiero. Por otro lado, creo que hay procesos que se han establecido en la región y que quiero que también, digamos, los tengamos aquí como referencia y fue lo que sucedió durante la pandemia, el convenio que la OMS y Costa Rica lo pusieron, que fue la llamada a la solidaridad, ¿verdad? Donde era entre los gobiernos, entidades de financiación en el ámbito de investigación, desarrollo tecnológico, instituciones, empresas, que expresaran su apoyo y solidaridad a los Estados miembros de la OMS en una plataforma tecnológica que se convirtiera en útil para el acceso equitativo a los productos sanitarios contra el COVID, por ejemplo. Esa fue puesta en la mesa, pero hemos utilizado situaciones similares en este momento en la región para seguir fortaleciendo las acciones que desarrollamos en el marco de la región centroamericana y de República Dominicana. Quiero dejarlo por aquí porque me parece que el planteamiento es, bueno, ¿qué estamos haciendo en el marco de financiación? Por supuesto, tenemos muchos cooperantes, tenemos a PEPFAR, USAID, que nos apoya fuertemente en procesos de VIH-Sida, incluso ahora tuberculosis y malaria, apoyado por la Fundación de Bill y Melinda Gates y Carlos Slim, ¿verdad? Que también nos vienen apoyando a la región. Y lo que hacemos es eso, desarrollar procesos regionales, desarrollar acciones, por ejemplo, en malaria. Tenemos acuerdos binacionales para trabajar en frontera y evitar que por un tema de migración o de movilidad humana haya problemas de migración entre los países regionales. Entonces, y hemos venido desarrollando con indicadores claves y con acciones claves a nivel de las fronteras, cómo poder apoyarnos y poder desarrollar mejor a los Estados miembros. Lo dejo por aquí porque me parece importante la discusión. Si hay alguna pregunta de forma específica. Gracias.
Muchísimas gracias, Alejandra. Creo que tendríamos preguntas, pero vamos a ver que los guardamos para después de nuestro último speaker. And I switch to English because we had moved from the Caribbean to Central America. And now we move to the other bank of what has been called the Black Atlantic, so to West Africa. Quentin, I give you the mic.
Yes, thank you very much for having me. And I really have, it's a lot of interesting things that I have heard, and I wasn't aware of all these organizations in Latin America and the Caribbean because I'm really working in Africa and mostly in West Africa. And I mean, some of the problems are, of course, similar, but I think they are at a very different level. And if we talk about funding and financing and money here in this panel, I think one has to be aware that money available in Africa is just much lower than money available in Latin America. So if we look at public health health expenditures, total health expenditures per capita in Ghana, that's $95 per year. In Brazil, it's about $850 per year. So it's like 10 times more in many Latin American countries than what is available in African countries. And Ghana is still one of the better off countries in Ghana. So in most other African countries, it's even less. And of course, when talking about health expenditures, I mean, in European countries, still health expenditures are, of course, multiple times higher. So in Germany, it's like 8,000, 9,000 euros per capita per year. So I mean, the level is just, I think it shows the range of what we can talk about when we talk about health expenditures, and having sufficient health expenditures is of course a question that depends on the income level where you're coming from. And the most important source of financing in most countries, except in very few countries in Africa, is domestic health expenditures, which can come either from public resources or from out-of-pocket payments. And the richer the country, the larger the share of public health expenditures in countries. So I think if we want to talk really about sustainable financing options in countries, we have to think about how to increase public health expenditures in countries. And that's also basically the main focus always of the World Health Organization, of how to raise and mobilize domestic resources, because relying on external sources, regional money, is not really a good option, because on the one hand, these regional, like if you look about like across time, regional external sources of health, which are a bit relevant in African countries, they vary a lot. So from one year to another, you can have between $100 and $20 of external health expenditures in Ghana. So that's not reliable source of funding for health financing in a country. And that is the case in many countries that are heavily dependent on external sources of revenue. So it's really not a good source of revenue to rely on external funding. And also sometimes if their countries receive a lot of external funding, also that kind of reduces public health expenditures, because then governments feel less obliged to really provide the funding for the public healthcare system. So I think one focus that is different from my perspective, also about much what I've heard about here, is that I really focus on the health system because my background is that I'm a health systems researcher, even if I'm now a professor in planetary and public health. And when I think about health systems, I always think about how those systems are financed, how they are governed, of course, like as the most important building block, how is the governance of the health system. But then the next building block for me for a health system is always the financing. And there, of course, the most important thing, or the first important thing, is where does the money come from and how is it raised? And there it is important how to ensure that public resources are available in countries, because domestic resources have to make up are the only viable long-term sustainable option to finance a healthcare system. And so one has to think about taxes and health insurance contributions and how to strengthen tax collection systems, health insurance systems, and how to build really mandatory health insurance systems. So how to enforce that, in particular, the better off parts of the population contribute sufficient resources to the healthcare system, because otherwise the system cannot be funded. And I mean, that's, I think, where still several Latin American countries are similar to many African countries, is that there is too much reliance on private health expenditures in many Latin American countries, where out-of-pocket payments, so that households pay out of pockets for their healthcare services, still are one important source of financing in many Latin American countries. And that's, of course, a problem, because then that pushes people into poverty. When they get ill, they cannot pay for healthcare. They do not have access to their healthcare services that they need. So the reliance on out-of-pocket payments is a big problem. And the other problem is the reliance on private health insurance, because that may contribute to protecting the richer parts of the population and maybe those with formal employment, but it's of course not a solution to providing access to care for the lower socioeconomic groups of the population. So therefore, it is important to always think about how to strengthen the public healthcare financing systems. And that's what I think, if one thinks about international cooperation, and where I think the focus should be, is really to focus on how to develop those structures, the financing structures that can raise those domestic resources in order to support in the long term the financing of the healthcare systems, and the healthcare structures that can then be financed with those sources from domestic resources. And the final point maybe, so, and there I think there can be a lot of cooperation, and even though often people talk about health system strengthening, I feel that there is in fact too little attention to the fact, like how resources are raised in countries, and how those systems to raise those resources and to pool those resources together of the population are organized in countries, and where a lot of international cooperation and maybe also funding from the EU could go and should go more into how to strengthen the health systems, the health financing systems in those countries. On the one hand, from raising the resources, but also from pooling the resources from the different sources together. So how to create the funding pools that pool resources from taxes, from insurance contributions, from private expenditures, maybe from revenues from rich companies, maybe from sin taxes that can be levied on polluting industries, and to transfer those from tobacco industry, to transfer those into the health system, that it can be then used to also pay and purchase healthcare services for the population, and to use to support countries in thinking about the revenue streams that they could potentially tap in order to generate more resources for health, by taxing polluters, by taxing like public health, like harmful products for public health, and therefore to have to benefit from both by reducing the consumption of those harmful products, but also by supporting the health system and strengthening the health system. But then the final part that I wanted to say, because now I come from health systems, but now I'm professor of planetary health, of course, and I heard several of you talking also about climate change and the importance of taking into account the relevance of climate change for health systems and for healthcare structures. And that's something that I also see as basically the overarching and one of the most important aspects now to think about how to make sure that health systems can deal with the challenges of climate change. And on the one hand, by reducing the negative impact that health systems have on climate change, because at the global level, at least, health systems contribute like 4 or 5% of global greenhouse gas emissions, and thinking about how to reduce those greenhouse gas emissions from the health systems is, I think, and should be an important aim of all people working in the healthcare system, and how to develop products that are less polluting for the environment, that are less polluting in terms of their production. And when thinking also about the production of vaccines, in the production of pharmaceutical products, that one also thinks of how one can reduce the negative impact on the environment, both in terms of chemical pollution for the environment, like if there are chemical pollutants going into rivers, but also in terms of reducing the greenhouse gas emissions and the carbon footprint of producing those medicines and products that are consumed in the health system. Because the most important contributor to those CO2 emissions in the health sector is not the health system itself, but the products that are used in the health system. So by the pharmaceutical products, the plastics that are used to keep everything hygienic, and the electricity that is used to run the machines in the healthcare system. So one has to think of how to do that. And there potentially I see also a role again for financing, like how to develop incentives that it makes sense for people working in the health system to reduce their reliance on the pollutant products, but also on reducing their greenhouse gas emissions, and potentially, of course, by taxing greenhouse gas emissions, which contribute to having negative impacts on the environment, by taxing potentially meat producing industries that have a very negative impact on the climate, one could also raise resources that could then contribute to funding the healthcare system. And with that, I'm over.
Okay, thank you very much, Willem. I think it showed that it makes sense to have someone work on different regions for us who work on Latin America to put things into perspective. And I think that just to mention, from the DAAD, there were 4 global health centers funded, 1 on each of the global South world regions, so Middle East and Asia, Africa and Latin America. And these will also meet together in different formats to have this exchange precisely. So I think that was very useful. And the other thing I liked a lot that you pointed to health insurance, because we always speak of international or domestic funding, private and public funding, and health insurance is one item, even connected with remittances, where we have countries or regions that are very strong in immigration, diaspora. So that's something to think of too, which we didn't come up so far, and I think that's a very valuable contribution too. With that, I have some questions here, but I leave them here and I hand it over to the floor. I give you the word.
Thank you so much. I'm Pilar Hernandez from SORMAS Foundation, and well, I think maybe, voy a cambiar a español porque creo que la pregunta, no sé, Olga, no es una pregunta, es un comentario, pero un poco a lo que estabas tocando antes, de ideas para financiamiento tenemos un montón, no hay problema. Una cosa que quería comentar es, se ha hablado mucho de la producción o del desarrollo de vacunas, pero creo que no se ha hablado suficiente de lo que es la prevención. Y con eso me refiero a surveillance systems, a vigilancia epidemiológica, que desafortunadamente todavía no es óptima en muchos países. Entonces quería hablar un poco de la experiencia que tenemos en la Fundación SORMAS. SORMAS, para los que no saben, es un software de código abierto, es decir, los países no tienen que pagar licencia para la vigilancia epidemiológica y el control de brotes epidémicos. La Fundación SORMAS es una organización sin ánimos de lucro, non-profit organization, y nuestro trabajo es apoyar a los países que quieren utilizar SORMAS, les hacemos formación, les apoyamos con la configuración de los sistemas, etcétera, etcétera. Y una de las áreas de trabajo en la SORMAS Foundation, la Fundación SORMAS, es lo que nosotros llamamos community building. Y ahí es donde quiero hacer énfasis, porque como estamos comentando, ahora ya es la tarde, he tenido oportunidad de hablar con varias personas, incluso en la pausa del almuerzo, ¿no? Al final, lo que son la colaboración la hacemos las personas. O sea, las herramientas digitales son herramientas digitales, pero la colaboración real es entre personas. Una de las cosas que hacemos en la Fundación SORMAS es reunir regularmente a los países que utilizan SORMAS y hacer que haya intercambio entre los países, ¿no? Y vuelvo un punto a lo que mencionaba Juan antes de la comunidad. La mayoría de brotes epidémicos o muchos brotes epidémicos empiezan en la comunidad y muchos trabajadores que trabajan en la comunidad necesitan herramientas digitales para reportar lo que está pasando, y eso es una de las aplicaciones de SORMAS. Entonces, lo que hacemos es reunir regularmente a los países que trabajan con SORMAS, y estoy súper contento de ver a Will porque él tiene 2 estudiantes que hacen su doctorado con SORMAS en Ghana. Hablando de cooperación triangular, por ejemplo, si alguien tiene interés en hacer en América Latina en sus doctorados en SORMAS, podemos contactarles con los doctorantes de Ghana, ¿no? Eso es uno de los trabajos que también se hace en la Fundación, saber qué país hace qué y poner en contacto. Pero bueno, mi punto final es la coordinación y la comunicación también cuesta dinero. Y estaba comentando también con una colega en la pausa, hablé hace unos meses con una persona de una fundación y decía, sí, la cooperación cuesta dinero y nadie nos aplaude, ¿no? Porque no es nada así como alguien inventa una vacuna, le dan un premio, ¿no? O hace algo innovativo. La cooperación está ahí, es súper importante y es la base de cuando hay algo como una pandemia, cuando esas redes ya existen a nivel, digamos, de población, entonces es lo que luego va a hacer que haya una respuesta adecuada. Gracias.
Muchas gracias. Propongo que coleccionamos un poco para después hacer una última ronda aquí. Creo que hay una pregunta del público, en línea.
Yes, I will read it. We have a question in the chat. Is where do you identify, if any, decolonization in regards to medical health, pharmaceutical systems, etc.?
No, I didn't catch it.
Where do you identify decolonization in regards to medical health, pharmaceutical systems?
Colonization.
Decolonization.
Okay. Okay. Leave that for the audience. You had a question?
Yeah, thanks a lot. Again, from DAAD, as Katharina was saying, we are supporting academic collaborations around the globe. At the moment, together with the Chinese Scholarship Council, we are the biggest in the world doing that. And we are planning to have this program of global centers to prolong that. It's a 222 million euros program. And we have a similar program financed by the Ministry of Economic Cooperation and Development, the SDG graduate schools of 14 million, which we will also restart in 2026. So the question to Olga would be, is there any possibility to co-finance those activities if we go together with European and Latin American partners like Nofec or Opreal, like partners like Zucker or SICA in Latin America? Or what would be the mechanism to come together under a global gateway umbrella? I don't get the mechanism at the moment, how we could do that.
Okay, thank you very much. That's precisely one of the goals of this meeting, to connect for practical purposes people that have the know-how, we hope, to do that. Any further questions from? Valeria.
Buenas tardes y buenos días para doña Alejandra. La pregunta es para ella. Yo también soy de Costa Rica y a propósito de la intervención que acaba de hacer la compañera de la Fundación Solmas, me preguntaba si en los proyectos de cooperación que usted mencionó hay alguno sobre que esté relacionado con el levantamiento de datos, porque después de mi experiencia también en el trabajo en Centroamérica, haciendo trabajo de campo, uno de los principales retos que tenemos para analizar los resultados del proceso de vacunación en general de la atención de la pandemia es los datos. O sea, todos los países tienen formas de reporte distintos y la realidad es que, bueno, también participé en una pasantía corta en la Universidad Javeriana y un poco hacían el chiste que hay mucho software y todo termina en un Excel, en el mejor de los casos, ¿verdad? Decían como, sí, todos tenemos muchos sistemas de recopilación de datos, pero a fin de cuentas, en el mejor de los casos, termina en un Excel. Y también en el trabajo de campo fue muy interesante, la gente decía, yo reporté a las personas vacunadas en un papel que le tomé una foto y lo mandé a la instancia correspondiente, porque en medio de una pandemia no da tiempo de formarse en el entrenamiento del uso de un software. Entonces, ahora que la compañera intervino, me parece como muy interesante saber si esto está sobre la mesa en los fondos de cooperación, porque creo que es un tema importantísimo para entender de lo que hemos discutido hoy, cómo estar mejor preparados para una eventual pandemia. Gracias.
Muchas gracias. Una pregunta más podemos tomar, sí.
Thank you. This is a question for the DAAD now that both of you are here. This second program that you mentioned that you will somehow finance to build up capacities, if I understood correctly, additional to academic exchange and collaboration and so on, how will work in the near future? Do you have any idea? The last program that you mentioned that you will also finance kind of research and build capacities and so on, or I'm mistaken?
Okay. With that, I will pass it back to the panelists. Katharina, give it to you.
Yeah, so I think you were referring to the PACA status that we're about to get. So that's like also the big question that we have to figure out with our colleagues. So just what Christoph said or asked, how to actually really get together, how like on an operative level, we kind of can work together so that probably already current running projects of DAAD can be in the future co-financed by the European Commission through this initiative Global Gateway, working together with investors, etc. And I think that's going to be the key question also for our future activities, how to kind of, make our projects that are obviously already going on, like GLACIER, like initiatives in the SDG partnerships that Christoph just mentioned, and the SDG graduate colleges that we are about to announce next year again. And maybe there are like ways to synergize these projects or initiatives to make it more visible, to get a bigger outreach, because I think, I mean, right now I just came back from like a lunch with a lot of like members of parliament, and of course right now you're talking about a lot of budget debates, etc. And we really don't exactly know how it's going to affect us, but it's not getting any better, unfortunately. And we have to be very, very realistic. Also, if we're talking about Europe, like as a whole entity, which of course we know it's complicated, but we also have other actors like in many regions. And of course we have to see, I mean, we're talking about the Global Gateway Initiative is like a counterpart, or like, if you want to call it like that, to the Silk Road of the Chinese. So of course, I mean, like Germany as a one single player cannot be competitive in that sense. So we have to really see how to cooperate in the future together and find like relatively unbureaucratic forms of how to channel our projects in the future.
So in reply, I think Alejandra wants to reply to one of the questions, right?
Yes. Okay. Just to your question, we have a coffee break coming up. Perhaps you can do it bilaterally. So we give it to Alejandra. Alejandra.
Bueno, muchas gracias. Para responder a la pregunta y hacer una observación en relación al tema de economía, la salud y financiamiento. Sí, sí estamos, sí está en la prioridad política el trabajar los sistemas de información a nivel de la región. Tenemos 2 apoyos financieros de la Embajada de Corea. Corea nos permitió, y bueno, por supuesto que con apoyo de OPS, nos permitieron realizar en este momento una evaluación de los sistemas de información, la madurez de los sistemas de información en los 8 países de la región. Ya tenemos el diagnóstico regional y sobre ese diagnóstico estamos desarrollando un plan regional de interoperatividad. No es tan fácil porque lógicamente va por la madurez que tiene cada uno de los sistemas y lo que se está viendo son la elaboración de las hojas de ruta de cada uno de los países y para eso también nos está apoyando el Centro del Control de Enfermedades de los Estados Unidos en desarrollarlo. Por otro lado, vamos desarrollando una app en materia de movilidad humana que nos permite ver la trazabilidad de las personas que se van movilizando. Fue en Costa Rica, precisamente en la pandemia, que se utilizó una herramienta generada por la OIM, una app, donde logramos ver la trazabilidad de la población no Becuglec que entraba a Costa Rica, recolectaba café y se devolvía, teniendo indicadores claves de COVID. Ahora lo estamos reformulando, bueno, y con población nicaragüense que también entraba a Costa Rica y se devolvía a Nicaragua. Y ahora lo estamos reformulando y tenemos apoyo en este momento de USAID, tenemos apoyo de Corea y tenemos apoyo del Banco Interamericano de Desarrollo para convertir esta app en la trazabilidad de la población migrante que está atravesando Centroamérica. Así que vamos a ver si hay inversión, hemos empezado a buscarla y claro, y aquí con la presentación que se nos hizo sobre el tema de economía. Acabamos de hacer un tema de, precisamente, tenemos una de las líneas de fortalecimiento de las capacidades de gobernanza y rectoría, y una de ellas es la medición de funciones esenciales, y vimos que el tema de movilización de financiamiento interno era difícil. Precisamente acabamos de terminar con la Universidad de York un estudio en los Estados miembros sobre el financiamiento en salud y cómo pueden ellos movilizar a lo interno y cómo los recursos principalmente aumentando sus capacidades y de negociación con los ministerios de Hacienda. Por supuesto, se presentaron experiencias interesantes, la que tiene Costa Rica, por ejemplo, con la Junta de Protección Social, que sobre las utilidades de la Junta de Protección Social, un porcentaje va a salud para materias de prevención en eventos importantes. Tenemos también los impuestos del tabaco que también se utilizan en materia de prevención, impuestos a bebidas azucaradas que tienen algunos países, pero entonces eso estamos en ese proceso de intercambio precisamente para generar recursos internos también a los países para poder atender las prioridades que están establecidas en la agenda política. Por aquí lo dejo la
Muchas
respuesta.
gracias, Alejandra. Estamos a unos 3 minutos para las 5. Katharina Fleckenstein ya nos dijo antes que tiene que salir en punto a las 5, entonces te doy muchas gracias por haber participado. Aún creo que nosotros podemos seguir unos 5 minutos, quizás más. A Olga le toca responder algunas cuestiones duras.
Voy a contestar un poco rápidamente, antes de que te vayas. Entonces, a ver, tenemos un presupuesto que es limitado. Los recursos se han cortado por todos lados. Pensad que para Latinoamérica y el Caribe 2021-2027 son 3.4 mil millones. Es nada.
¿Millones?
Mil millones. Billions. Sí. Pero es toda la cooperación bilateral con los países más lo regional. Es peanuts. Entonces, Global Gateways no es un instrumento financiero. Global Gateways es una estrategia de trabajar todos los actores conjuntamente de la Unión Europea para ciertos proyectos en particular y ciertos objetivos políticos. No se financia cualquier proyecto, no se financia cualquier inversión. Son inversiones y proyectos que tienen un objetivo de política pública bastante claro y que tiene que estar concertado a alto nivel político, porque si no, no nos vamos a mover. Entonces, te podría contestar, sí, lógicamente podemos colaborar, pero no lo sé tampoco, porque necesitamos ver dónde vamos. Yo voy a estar en la Roundtable posterior, en donde un poco vamos a discutir cuál es el camino hacia adelante, pero sí que me gustaría que nos sentáramos en bilateral. Global Gateway es una estrategia de todos los Estados miembros. Entonces, por favor, presionad al gobierno alemán que queréis que Alemania sea parte del Team Europe en salud. Hemos hecho ya reaching out por todos lados. Cuesta mucho también llegar a la persona dentro de cada gobierno que trabaja sobre ello. Una de las cosas más difíciles para mí en este momento es ver en un mismo Estado miembro todo lo que aportan a un single proyecto. Porque ¿quién tienes? Los de cooperación, hablan de cooperación, GIGA y tal. Los de comercio hablan con la industria farmacéutica, les dan crédito, hacen misiones comerciales. Pero lo que hace cooperación les da igual. Los académicos tenéis networks en los que nos tendríamos que estar apoyando. No nos hablamos. Entonces, Global Gateway es esa estrategia de poner todo el mundo en la mesa. Toda la gente que quiera formar parte de plataformas que estamos desarrollando con la industria y tal, por favor, decídnoslos, vamos a poner en la mailing list. Somos humanos también, somos dos personas tirando adelante las plataformas. Pero sí, por favor, y en cualquier caso, una reunión bilateral la hago con mucho gusto. Para la academia, Horizonte Europa es el instrumento financiero. Entonces,
bueno,
sí.
Vamos a continuar esa discusión también en la mesa redonda, como dijiste, y también la pausa. Unas palabras casi finales de los otros panelistas que has de Belén. No. Entonces tú haces una respuesta breve y después veremos cómo le tratamos a Félix.
Quería recoger un poco las palabras de Olga en cuanto a cómo cooperar desde un país como Alemania en esta Team Europe Initiative. Desde el año 2022, España está coliderando con la Comisión Europea este programa, este proyecto en 3 líneas. Fortalecimiento de los sistemas de salud, la promoción del sector privado para crear un ecosistema sostenible de inversiones público-privadas, identificar alianzas público-privadas y además fortalecer todo lo que es transferencia de tecnología, I+D, conocimiento, capacitación. ¿Qué necesitamos para unir esa alianza con Alemania y con otros Estados miembros que tengan interés? Bueno, pues que tenemos un reto y llegar a la cumbre del 2025 de la EU-LAC en Colombia, en Bogotá, y mostrar un poco todo ese pipeline de proyectos en donde a través de la Global Gateway podemos mostrar qué podemos ofrecer desde Europa con la región América Latina y Caribe. ¿Qué se puede hacer? Pues desarrollar un plan conjunto de trabajo. Alemania, España y otros Estados miembros que se están uniendo ya, mostrar una agenda relevante de actividades, aportar conocimientos, intercambios a través de workshops con agencias reguladoras, compartir formación, best practices y además buscar que las compañías de la región de Alemania, de España, de otros países en Europa puedan invertir en el sector, facilitarles esas inversiones en un entorno con una regulación que permita, ¿no?, el acceso en equidad sostenible en términos de cooperación internacional.
Bueno, muchas gracias, Belén. Entonces, iba a dar la palabra. I was going to give you the word to Angela, but if you promise to be very brief.
I will be super brief, and I will also come back to what I was asking Angela. But now, of course, not to Angela. This question is really to the roundtable. So, I mean, I'm combining Angela's excerpt on the funders of CARPA with Wilm's. If we depend Willem said, hypothesized that external funding may decrease the felt obligation of national governments to fund a supranational. You said it to their own national health, but I will combine both, because I think it's great we have a Caribbean, a supranational health agency. That's really important, and it's a model for Latin America. If Latin America or South America, whatever comes out, was to have its own CDC. Now, sustainability is the question. All the donors, Olga mentions donors, GIZ, German government, usually, in my experience, they want counterfunding. They want a bilateral thing. So how do we do this? You mentioned taxes as an option, like tax polluting industries. Interesting. I mean, really, anybody giving an opinion. So how could we fund an EU-LAC Center of Health, whatever you want to call it, from a member state perspective? If I understand correctly, that the EU is not. So I'm sorry, I was so ignorant. I thought Global Gateway was full of money. So I understand. No, you're not. Okay, got it. So how do we fund this? This is a big question, I know, but please give me insights. And I have a second provocative comment. If we get the member states to fund it, so Spain gives a bit, Germany gives a bit, but also Brazil gives a bit, and then Honduras gives a bit, then in my opinion, $1 from Honduras should have more value than $1 from Brazil, because Honduras, so it would be weighed by the economic strength of a country, while still both countries, Honduras and Brazil, would have the same vote. I'm not sure if that is wanting too much. Can anybody comment on this?
That was almost brief, and it almost invites a very brief answer. Angela, I think it was to you, and we would take it up in the roundtable, and you're of course both very much invited to stay for the roundtable too, and you can jump in there. Angela, I give you the floor, and then Willem will get
I think the
last words to close it.
Yeah, no, I think the biggest part is what you mentioned, which is the sustainability. And I think, as it was mentioned earlier, and it's a good idea, some of those, some of those persons who have, say, persons or companies that have created some of our health problems should also contribute to the health problems monetarily. But how do you do that is a whole different, is a challenge, because it becomes very political, of course, especially from our perspective in small countries. Politics do play a big role. When you come in to penalize, it then becomes a problem, because they see it as being penalized. They don't see it as contributing, as a contribution. But I think it's very important, and it's something to think about. But I think sustainability, because from our perspective, our greatest problem is, even though we have, say, contributors, what we'd say to our core budget, I think in any one year, we probably collect about 50-something% of that, as opposed to sometimes you might get a better year depending on how the economies go. But say like when we had COVID-19, where most GDPs got a big hit, of course, our quota contributions went down. So you really need to be able to tap into some kind of resource that is consistent. If not consistent, it's at least it's substantial enough to have the institution continue its business.
Okay, thank you very much, Angela. Will?
I'm still thinking about your question. I think it's too difficult to answer. And I think it's related also to the political point about how to, because once you talk about money, it gets very political, and taxes, of course, is one of the core business of the government and the parliament, how to decide about how to raise funding. But on the other hand, a Center for Health, probably it wouldn't be that big. So like compared to the resources that a government has available, or that all Latin American countries together have available, this Center for Health would be peanuts, as you said, right? Because your 13 billion euros peanuts. I mean, that's compared to what a Center for Health would cost. It would be peanuts.
Okay, there can be smaller and bigger peanuts. No, I would save a bit our coffee break, but I just want to take up the idea that was put up this morning to think of the health sector as an investment like firefighters. I think that is a very good image also to convey to funds and to politicians. You don't want ever to use the firefighters, but you do want to have them. And that is a very popular image. Everybody loves the firefighters and they pay for the firefighters very voluntarily, and they don't do so for many other items. So I would like to take up that idea really to think of it as investment in terms of infrastructure, which we hope we don't need often, but which we are all very happy if we have it in place once we need it. And with that, I would close our panel for today. Thank you very much once again to the panelists here and to Alejandra and Angela online. It's been really very, very helpful to have you with us. And now we see each other in 20 minutes for the final roundtable.
And we will start with a short video which was prepared by our president, Leire Pahin, and which I ask to project now. And Felix, then I give you the floor.
Good afternoon, everyone. Greetings to my colleagues of EU-LAC Foundation, GIGA, GLACIER, of course, my friends of this global and other partners. Thank you so much for coming, and thank you so much for participating in this relevant discussion. Unfortunately, I was not able to be there today, but I would like just to remark 2 or 3 topics to add to the discussion. En estos tiempos en los que hemos vivido una crisis ambiental, social y económica relevante, debemos preguntarnos, después de la pandemia, sobre todo, si estamos mejor preparados hoy que en el año 2019 para las nuevas crisis que sin duda van a llegar. Si tenemos mejores herramientas, si nos hemos coordinado mejor, si tenemos mayor financiación y nuevos instrumentos. Y en esa respuesta hay, como en casi todos los análisis, una realidad agridulce. Por un lado, hemos avanzado a nivel multilateral en acuerdos y tratados internacionales en el ámbito de la Organización Mundial de la Salud. También lo hemos hecho a nivel de la Unión Europea, construyendo una nueva institución, ERA, que permita actuar en una respuesta global de la Unión Europea de forma mancomunada en todos los Estados miembros. Hemos también iniciado el camino de algunas discusiones relevantes que surgieron durante la crisis, como era la necesidad de mejorar la capacidad de producción y de acceso a las vacunas y al resultado de la innovación y de la investigación de los países del norte por regiones como América Latina y el Caribe o África. Es un buen camino, pero sin lugar a dudas tenemos que seguir caminando para mejorar, por un lado, esas instituciones que nos permitan anticiparnos, que nos permitan preparar mejor las respuestas de una forma coordinada a nivel global. Me parece muy importante que instituciones como ERA puedan ser conectadas con otras herramientas e instituciones que a nivel regional en América Latina y el Caribe se están construyendo, como es el Observatorio Iberoamericano Epidemiológico o otras muchas. En la misma línea de lo que ya se ha venido haciendo conjuntamente a nivel regional con esa autoridad para la prevención y respuesta a los desastres naturales. Tenemos que ser capaces, por tanto, de conectar el conocimiento, la ciencia, pero también las capacidades de respuesta y de prevención de ambas regiones. Tenemos que aumentar y mejorar también la transparencia y la participación del ámbito científico, académico y de la sociedad civil, instituciones como ERA. Tenemos que avanzar mucho más en esa necesidad de financiación y de garantía de producción de vacunas a nivel global y especialmente en regiones como América Latina y el Caribe, y trabajar conjuntamente en esa dirección. Y tenemos también que ser capaces de avanzar en mecanismos de respuesta, fortalecer los organismos multilaterales que tenemos, la OMS, por el Tratado de Pandemias, para que tenga mayor capacidad y garantía de respuesta a nivel global. Y, cómo no, debemos garantizar también la financiación. En todos esos objetivos, el Parlamento Europeo tiene un rol muy importante en los próximos años, para esa transparencia, para esa garantía de acceso y también para la financiación. Y sin lugar a dudas pueden contar conmigo en los próximos años para avanzar en esa dirección, después de que durante este último año ya hemos tenido hitos relevantes en la asociación biregional entre la Unión Europea, América Latina y el Caribe. Esa cumbre de jefes de Estado y de Gobierno que puso encima de la mesa una nueva autoridad biregional que monitoree, que implemente los objetivos comunes y que es una oportunidad para que la salud global y la preparación y respuesta de las crisis sea una prioridad en la agenda y que podamos construirla de forma birregional. Durante este tiempo, desde la Fundación EU-LAC, hemos colocado la salud global en el corazón de la agenda birregional. Lo hicimos desde el principio en seminarios que abordaron la necesidad del acceso a las vacunas. También lo hemos hecho cuando hemos abordado la necesidad de construir espacios birregionales de participación académica, sociedad civil y tomadores de decisiones, de conectar mejor la ciencia y la toma de decisiones. Y lo hacemos también en este simposio donde entendemos que tenemos que empujar en esa agenda birregional para mejorar la preparación y respuesta a las crisis. Durante los próximos años, como digo, me pongo a su disposición para seguir avanzando en ello y, por supuesto, seguiré muy atenta a las conclusiones que hoy salgan de este evento para continuar en esa dirección. Muchísimas gracias.
Thank you very much, Leire. Thanks everybody for staying with us until the final roundtable that will be followed by some snacks and some wine. So it will be worth your time scientifically and hopefully also gastronomically. But you will have to work for it. So we have 90 minutes. It has been an intense day, but it's worth the final roundtable, which will summarize a lot, which should summarize a lot of the debate that has, or not summarize, continue maybe and get to some tangible conclusions. Before we start with the roundtable, we have been lucky enough to have some of us you have seen today already. Olga has already presented, I have already presented, but I would like our two additional roundtable members to present themselves, and to Ciro Ogarte is also online now, so we have 3 people to present. Would you like to start? Thank you.
Hello. Thank you very much. My name is Martin Bergfelder. I am a diplomat from the German Federal Foreign Office, and I'm dealing with the global health stuff. So I'm leading the global health team in the Foreign Office. So I'm not the doctor, or we have like a little doctor team that takes care of our diplomats abroad. That's not my job. It's more the policy stuff. I started in this job at the beginning of the COVID pandemic. So first 2 years were mostly crisis management. And then the last 2 years was more, let's say, looking ahead, what we can do better. And especially I had the pleasure the last 2 years together with my colleagues of the Ministry of Health to negotiate this beautiful pandemic agreement, which we haven't yet concluded, but it's not over. So I thought that might be something we can reflect upon, but obviously I'm happy to speak about other things. I haven't prepared anything, so I'm more interested in a lively debate rather than giving you a lengthy presentation about what Germany does and why the Foreign Office is so important and why this is not only about health and all of that. I'm sure you have heard that millions of times, but if you insist, I can do it also. Thank you.
Yeah, thank you so much for having me. Like you already said, my name is Michael Bayerlein, and I'm a postdoctoral researcher at the German Institute for International Security Affairs. And at the Institute, I work on a research project on global and European health governance. And I'm a researcher on European health policy matters. And during the pandemic, I kind of came towards the health aspect of European policy making, and that kind of stuck with me. And now, due to the work at the SWP, I also extended or broadened my scope towards the more global issues, and also did work a little bit on the pandemic agreement, but mostly on European health policies, the external and the internal dimension. And in that regard, I also worked a little bit on cooperation with Latin America, or possible cooperation, which I'm happy to talk a little bit about soon, but I don't want to take up too much time, and also engage in the discussion here.
Thank you very much. Ciro, do you want to? He's not yet connected. Okay, got it. Well, then let's get to matters. I think a good start for the roundtable is to come back to the pandemic treaty. We have discussed this in the morning session, and our Brazilian colleagues were very, so several people raised the voices so some of the challenges were addressed, and Anna from the EU-LAC Foundation presented some of the, she presented like a few of the aspects that are under fire, so that are preventing ratification at the moment. So this was already discussed. I think you were not yet here, so many of the, for example, IP issues, or how legally binding is the treaty, it may be a point of debate, and then the question of penalization if countries do not follow the procedures. So this was also briefly mentioned. So it's not a completely new topic to this audience. At the same time, people have raised the voices that I think Antoni from IS Global said that there is no plan B. So the pandemic treaty is the plan A, and it should work somehow. But maybe you could comment further on how you perceive the prospects for this to actually come into place. As you said, the game is not over. So maybe you can comment a bit further from your, of course, personal perspective.
Sure. Difficult?
Yeah, because then the online.
Can you hear me?
It's more for the online people.
Okay, very good.
Is it on? Anna, is it not on? It should be. No, it should.
Better. Okay. Okay, very good. So it's a bit difficult because I haven't been there in the morning, so there's danger that I'm going to repeat some stuff. Well, I mean, first of all, don't say treaty. It's called agreement. This is very important for our American friends. They don't like the word treaty because the word treaty means they have to go to the Senate, and that means they cannot join it. So let's call it an agreement. Secondly, well, I wouldn't be so pessimistic to say it's a big failure that we weren't able to conclude this in 2 years. If you look at this agreement, it covers, or it tries to cover, a very broad topic. It involves all ministries. We have, I don't know how many interagency meetings we have had in the German government, and you really have everybody, including Ministry of Defense or Ministry of Agriculture or Environment, many ministries that usually would not be part of a traditional health agreement. So it's very broad, and it's not only a health issue. I think you have already mentioned IP. So there are, let's face it, there are strong economic interests involved in this, security issues involved, geopolitical issues involved, and many, many more. So it's a complex animal, and I think the Tobacco Convention, I don't know how many years it took, and it was quite limited to a single issue. So there is hope that we're going to get there. I think we have now, the plan is to conclude this in a year, or at maximum in a year. We can only achieve this if we, I think, continue on the path of not solving all the issues in this year. So this will definitely not be the end. So there's some kind of built-in agenda to do more on the most crucial issues. So they will not be all solved this year. I think that's clear. And then also we will have a proper, I think, agreement, legally binding. That's I think for the moment where the train is going. So it will take time in terms of ratification also afterwards. So for all those who think we might see the next pandemic already on the horizon and we need to act quickly, I think it would be unwise to only focus on the pandemic agreement. We will, nevertheless, we will need to have some kind of interim structures to make sure we are ready if the next pandemic hits us tomorrow, because even in the best case scenario, it will take a few years until this comes into force. That's just the reality, I think. I think what we can positively take from the World Health Assembly is that we managed to get the IHR reform through, which was not a given. It's a much more technical process, but still more or less all the issues that were in play in the pandemic agreement in one form or the other also came into play into the IHR. So that we got that through is, I think, a big success. And there's a lot we can learn from the IHR process. I don't want to bore you with technicalities, but also learn for the pandemic agreement, starting from excellent leadership of the Bureau, starting from the willingness to compromise from everybody, the willingness to involve experts, to involve stakeholders, to make use of informal settings. These are all things that when we tried them in the negotiations for the pandemic agreement worked well. That sounds, quite simple, but I would say at the end, shortly before the World Health Assembly, we were under very heavy pressure, everybody, to get this over the line. And the more everybody got pushed, the more we got antagonized and started to move away. So we were quite close to an agreement, but then with too much pressure, it more or less fell apart. And I will not name and shame anybody, but I have said geopolitical issues play a role, and let's not be naive. There were definitely many players or several important players in the room where sometimes you could ask yourself whether they are really interested in this agreement or whether this is just a political game. So obviously not Germany, obviously the European Union, but also, and I will stop there, we can go in all the details and all the hot topics if you want. I think what is really crucial, and I mean that, the impression of some people like to frame this, this is a European pet project, so it's a European idea, so it's for the EU to solve this and to compromise and to deliver. I think that would be wrong, a wrong perception. It can only work if this is really a shared endeavor by everybody. It's clear that there are differences in the capacities of countries to respond to pandemics, but we will only get this done if this is really perceived as a shared endeavor of everybody. And I think also if it's not only focused on responding to pandemics. So it was quite difficult actually to get the argument through to many people that we also need to take care of prevention and of preparedness and not only focus on reaction. That might sound to scientists totally crazy, but this process has sometimes had a problem of keeping experts and stakeholders deliberately out of the room. And that's probably the worst thing that can happen, is diplomats sit around and negotiate stuff where they have no idea what they're actually talking about. Last thing, it is what it is. When I came into the job, it was pandemic, and you had the feeling there was nothing else on the political agenda. that has changed. And we all have to struggle to keep this on the political agenda, but it is impossible to think that we just need to involve our heads of state and the ministers, and then they will solve this. So that it was impossible. If that would have been possible, we would have solved this at the World Health Assembly. We were simply not close enough to really bring in ministers and say, these are the 2-3 sticky points for you, you know, bargain, guys, and let's get it done. So there was still, I mean, the text is public. There's more than half of the text is still disputed, and these are the most important parts. So without the people, the experts, the negotiators, it will not work. Simply just saying we need to put this to the political level and then it will be solved tomorrow, I think is not a reality. Last thing, unfortunately, if you look at the European Union, I mean, you all know how the politics are, and we can see that it's getting more difficult to get support for the pandemic agreement in relation to the domestic political situation in countries. It's not only the European Union. We had huge demonstrations of anti-vaxxers in Geneva. There's a push from the far right, orchestrated also through social media against this, and the governments are feeling the pressure definitely on that. And there are, I think Germany has so far held the ground, but we can see this also in smaller forms coming also up in Germany. Maybe I'll stop here because then I continue and get into ranting. Just fire questions at me.
Well, very interesting. Thank you. I mean, I have a few ideas, but to address to that, but I would first like to hand over to Olga, because the European Union was mentioned repeatedly by Martin, and I think I was even going to ask before, but now he addressed it twice at least. So, I mean, you as representing DG INPA, so what's your take on the, let's say, potential for action from an EU Commission perspective and like roles and responsibilities, you know? Can you comment briefly?
To say that I love the Commission, and I was so glad that the Commission was negotiating on our behalf. That helped a lot. It would be a catastrophe if the European member states would negotiate on their own. So we obviously supported the Commission all the time. Sometimes we disagree, but I'm really, and it's not a joke, I'm serious. I appreciate very much what the Commission is doing. It's DG Santé, but of course we also love DG. Thank you.
So, well, I'm not in the global health. I'm in the geographical Latin America and the Caribbean, and I think that whatever happens in the agreement, we need to continue to foster the collaboration with Latin America and the Caribbean. And what we have done after the summit is to push to have health on the agenda. And we do it through all the meetings that I explained before, the high-level, regional meetings that we have done on health. It was to keep the issue on the agenda on the top. And 1 month ago, the president of Colombia, who's going to have the temporary presidency during the next summit, he had highlighted 3 priorities. One of them is the common production of medicines and vaccines in Latin America. And what we have told them is that we are going to be there. We are going to be there to support really this endeavor. You asked also one question before in the previous panel. I think that the problem is not the financing. The problem is the politics. If Latin America and the Caribbean do not get together to move this forward, it's going to be very difficult. I want just to finalize one thing. So what we are trying to do now on the next steps, so we want to be in we have signed up three strands in which we want to work together. One is to have more harmonization at the regulatory level. The second one is to have the capacities for having local manufacturing. And the third one is on investigation and research. What we're trying to put now together is a regional program that can help the decisions that the Latin America and the Caribbean take to move them forward. We are having conversations with EMA because we would like to have EMA with us also helping on what they decide how to move it. And then we have put together also with the agency, the ELA agency, we have put together with the industry, so the first dialogue was with them. We want to arrive to the summit with something tangible, and this gives a perspective to have another roadmap now for the summit in November 2025, and to start really working on specific projects.
Michael, before I switch, I will ask you on your take on what has been said now from a like from somebody analyzing European policy without being part of the Commission or another part of the Commission or diplomat. Just to be clear, Olga, I think, and I won't explore, I'll go back to it because I don't want to take Michael, first, debate, but I think it's wise not to mix the pandemic treaty with what I tried to call for in the previous session is super regional without going to a level of 194 countries. So like having tangible instruments, including Latin America, that are sustainable, which is why I insisted so much on who's going to pay for it. Because if we only depend on philanthropy or on government money from people, for example, Spain, traditionally interested in Latin America because they colonized it 300 years ago, it's not, I don't see it working. I don't see it working, or England for Jamaica and part of the English-speaking Caribbean. So this is why I think in this room at least and online, it's not working. Oh, sorry. No, that's me using it wrongly. I'm so sorry. And I will, I hope it's better now. So I'm really interested in having regional level CDCs, including Latin America. And I don't even know if all of South America is a good structure for this. But I'll get back to this if we have a debate. But I really don't want to mix more of super. So because you put it back to the EU, and that's good because this is a meeting that has the nexus between the European Union and Latin American. So this is absolutely in frame. But of course, now we are at a very high level of a pandemic agreement, and thanks for bringing this. So before I reach out to our Brazilian friends and to Antony to comment, I would like to give the floor to Michael to have your thoughts on this. Over.
Yes, thank you very much. So I'll try to combine all the threads of all that was said today.
Is the battery over? Ours is working.
No.
Okay, so let me start out with that. What I want to talk about is the connection between the lack of trust and the lack of solidarity that has been created due to the pandemic and inequity during the pandemic to cooperation between the two regions and how to rebuild trust between the two regions. And I want to start off with the pandemic agreement, which I wholeheartedly support. And I think this will be a very important pillar in creating a better new global health architecture. However, I would also argue that unfortunately, the current pandemic agreement is really just that, like a starting point for that, for a better health for all. Because the articles as they're currently drafted, and especially the pathogen access and benefit sharing system is, in my reading, somewhat of an epitome of the distrust that exists between the countries, or that is still existing, and that is an outflow of what happened during the pandemic, right? If you just imagine, and I want to just use that as an example, that we enter, if it comes into effect in the way that it is currently discussed, in a way of like pseudo tit for tat, where developing countries are kind of forced to hold pathogens hostage in order to receive benefits that, or in order to receive somewhat equitable access to vaccines, right? This is not really a base of like trusting reciprocal cooperation. I don't want to say that the system is bad, and that it should be totally scrubbed from the pandemic agreement. I just want to say that we should not, and I know I'm talking to a lot of peers that I have the same opinion, that we say, oh, now we did it when the pandemic agreement is finally like decided upon by the World Health Assembly and ratified. So what is the alternative, or how should we, like you just said, build from there? What is needed? And I want to argue that one avenue for rebuilding trust and cooperation could be the reciprocal reliance in health matters, and especially pharmaceutical production. So not only vaccines, but more than that, right? We talked about vaccines a lot, but it is more general issue of pharmaceutical production and concentration, reliance on certain countries, especially India, and more than India, even China, where both regions, the EU and Latin America, are kind of like in a situation where they could engage in a like win-win cooperation, because the EU wants to build up new capacities for diversification to pursue its open strategic autonomy, and Latin America is also striving for pharmaceutical autonomy. There's the GLACIER plan for self-sufficiency, and so those are really two actors that strive for the same goal, right? And we have strong pharmaceutical capacities in the region, and nonetheless strong trade asymmetries, with the EU importing a fraction of pharmaceutical products from the region, while, for example, Mercosur countries import like 50% of finished pharmaceutical products come from the EU, 20% of active ingredients. So there's a huge asymmetry in trade. However, there are certain countries, especially Brazil and Argentina, but also smaller countries, that are like actually developing into pharmaceutical powerhouses that the EU is not, let's say, harnessing. I don't want to say harnessing, this is very post-colonial, but engaging with in a way to cooperate on an eye level in order to strengthen the diversification of supply chains for both regions. And I just want to end on 4 points, or 4 ways in which the EU could accomplish that. First, and we already talked about that, redesigning the global value chains, especially with a focus on R&D, right? The region is producing pharmaceuticals, but they are producing them. They're not developing the pharmaceuticals. And one possibility would be to use finances from, for example, Horizon Europe, research grants, in order to foster cooperation between the regions. Second, to intensify the cooperation via the Global Gateway strategy. I don't want to go too much into detail. You eloquently already elaborated how this is going down. Third, the support of local public procurement schemes, which will be needed. We talked about like the firefighters that are also needed in peace times, let's say. So having these capacities, even when there's no pandemic, local sustainable production that might be even under threat in like EU-Mercosur free trade agreement, through supporting like these buy local schemes could be illegal under such a free trade agreement. So this has to be kept in mind. And last point, regulatory cooperation, which we also already talked about, streamlining regulatory processes. There's there are a lot of pharmaceutical companies in the region that are not approved by EMA. So how can we get these approvals through EMA, through cooperation, for example, by expanding the cooperation that already exists between EMA and the Brazilian Health Regulatory Authority to the region, for example, by an interregional agency. I'll leave it at that.
Very interesting. Thank you, Michael. Before I ask my board or roundtable members to comment, now 4 Europeans have issued the word. Can I ask our Brazilian community? I mean, we've heard Tanya, maybe you want to comment on your perspective. Also, your cell phone was ringing way too long, so now you're on. So, I mean, what's your perspective on the pandemic agreement? And on what Michael has just said in terms of eye-level interaction? Do you want to? I mean, I don't even ask if you want to comment. Can you please comment from your perspective? And just so we have 3 vice presidents of Fiocruz sitting there, which is the largest, by far the largest Latin American research institution under a mandate, not a mandate, they get money from the Ministry of Health, but are a key player in the whole continent, actually, in terms of health and they strongly fostered, they declared strong interest in the pandemic agreement in their talks. So let's hear it from them.
I don't think it will be so easy. You know, I really think that it's fundamental to go on working on it, working on it. But as you have just said to us, it will take some years to get into practice during this period of time. We don't know what's going to happen next 6 months, even 1 year. It might happen any kind of thing during those periods. So we have to strengthen cooperation while discussing this. When Lourdes was talking with us, and we said, we have to go there together and see what's going on, because it's very important for us from Latin America, Caribbean, and Africa, that any kind of cooperation, you have to work on it, work really hard on it. But we are from Brazil, so everyone says to us, oh, you're rich. No, we need cooperation. We need to enhance our capacities. Even us in Fiocruz, like we have biomanguinhos that we can produce vaccines and diagnostic tests. But it was really, really, really hard for us to get some supplies during the COVID time. It was really hard. And I'm in charge nowadays in the surveillance and reference laboratories. It was really hard to get this kind of access to supplies in general. And it was not easy for us. So it's not, it's not easy for me to listen to it. You can compare yourself with Africa and know that, but we can compare ourselves with you. It's the same. So how can we strengthen our capacities while this agreement is not working on? That's the point. That's why we are here. What are other options? We have Plan B, and Plan B is cooperation. While it's not working, we have to still work on it. We have to do it. Like us at Fiocruz, we cooperate with CDC, PAHO, WHO. Fiocruz have more than nowadays 5 centers with WHO. It's not enough. We can't talk even about pandemic. We are dealing with arbovirus right now, or malaria in the north of the country. So we are dealing with all those things at the same time. At the same time. We are also doing dealing with NCDs, non-communicable disease. So it's not an easy answer. We have to cooperate, and you have to count on you. And I don't want to listen to this kind of thing. You rich, like comparing ourselves with Africa. We cooperate with Africa. We Fiocruz. We cooperate a lot with Africa. We have many agreements with some countries in Africa. You know, that's it. That's the point for me. We have to cooperate, and we have to enhance other forms of collaborative ways of working, while this agreement, I mean, pandemic agreement, is not working on. But we have to go on in this direction. But we have to be, that's my opinion. And we have to have to be, because we don't know what's going to happen next 6 months or next year.
They have a plan B. You said there is no plan B. Can I hand you the mic?
Yeah.
So you want me to comment? Thank you very much. So I come from academics, and so I don't have the rhetoric of politicians, and I don't have the patience of diplomats. And what I wanted to bring here to the discussion is something, that's why I said earlier this morning that there was no plan B, or there shouldn't be a plan B. It's a sense of urgency. And I know that this is sometimes difficult to reconcile with political dynamics and diplomatic dynamics. But let me bring to the issue is that one of the lessons, there's at least among the many lessons, but one of the highlights of the pandemic, of the impact of the pandemic is, this is the discussion of the pandemic agreement is largely a discussion about equity. And that's, if we don't have this in mind, we won't move forward, because the impact of the pandemic has largely been, or the experience of the pandemic has largely been the experience of how some can handle these situations and others are not able to handle the situation. So that's one thing. Unless we understand that we need to face equity to avoid serious conflicts at many levels, then it will be very difficult to come to find common ground. And the other learning of one of the learnings of the pandemic is that we shouldn't take anything for granted. And I'm talking now, connecting with your point regarding trends in Europe and trends in the European Union. The window of opportunity for agreements like this is closing very fast. So I want to bring in the discussion this sense of urgency, because things might get really worse, and I don't want to sound dramatic, but realistic, because we see that really the alignments that seem to be operating early on in the process of the discussion of the agreement, probably, or it's likely that they will evaporate, unless we bring the issue maybe of security. So we shouldn't be talking about preparedness and health, but maybe security, because for some, the issue of security seems more appealing. So just sorry for the long comment. I insist that there is no so many opportunities after that. We should have a sense of urgency, and let's not take for granted a little bit even the leading role of the European Union in this process. So if we don't hurry, maybe it will be definitely a missed opportunity, with increasing likelihood of other global threats that strongly disrupt the planet. So that's just a comment that I would like to hear. I'm looking at you, but I fully agree, or I largely agree with the comments of our other German colleague. Thank you.
Thank you so much. So I think there is an underlying layer on really building with time. So one thing is the urgency, I agree, but you need to do the fast things fast and the slow thing with patience. And Europe actually has this S3 structures with research infrastructures. And as I mentioned, I was working with 3 of them earlier and merged them, which are most relevant for health, but there are around 13 which are relevant for health. One of the challenges when we try to get them to be activated in Latin America is, how do you get members in? Because if you get more members in, and there are more countries in Latin America than you have in Europe, then where is the power? A very, very stupid question, which actually stopped the process. Because the research infrastructures are not made in a way that all the European countries are members. It's you go in, you choose which one you're in, and then you do agreements on that part. I do think that these are very, very important. They are not sexy. You will not be a president elected because you want to push research infrastructures, but they are extremely important in building standards, in building stable, long-term collaboration. And I do think this is an asset that Europe and Latin America could work on together. But there are some imbalances that need to be fixed because they were made for Europe. They were not made to expand. And there you can actually build the ground up. It probably takes you 5 to 10 years to get to something that's really valuable, but you have to start at some point. And being deep science and getting all this knowledge that we have talked about with vaccines, it's not a purchased product that works the next day. You really need to build these things as well.
We've heard, so I mean, I will come back to this calls for, I think both Michael and Martin could comment. Martin's next to me. Can you, I mean, we have a few timelines mentioned here. So we have so Bogi, Eliasson thinks that we can scavenge existing infrastructures for a midterm process to, if I get you right, correct me if not, to like continue shaping the process of.
Yeah, because in Latin America, you have scientists, but you don't have the structure.
Mm-hmm.
Right? In Europe, you have the structures, and you are even lack of scientists.
Yeah. Yeah. Okay. Well, Bogi is so for the translators and the online community. Bogi is again highlighting the lack of structure in Latin America, and well, you mentioned that earlier. The question on whether the existing infrastructures that would join the 2 continents are equitable, and whether this could, and now I'm extrapolating, whether those could be instruments to shape and contribute to a larger global framework such as the pandemic agreement. So, I mean, maybe any of you, I will hand to you first, and you have the urgency issue also to address.
Yeah, I don't know where to start. And I'm thinking about how much fire I want to put into this to get it make it more lively, which would be quite unusual for a German diplomat, but that's what I like to do. I mean, first of all, sense of urgency, yes. The counter argument to this is ram something through where important players will simply not stand in the way. And then afterwards, just simply walk away from the thing, not ratify it. Then you have a nice piece of paper and next pandemic hits and you can forget about it. It's not, I mean, I have experienced the pandemic not from the first day, but I think I came into this at Easter in 2020. So in the political system, struggling to set up the policy response, struggling. My predecessor had like 150 verbal notes from around the world screaming for help on ventilators, masks, and then later therapeutics, vaccines. I was involved in the setup of ACT-A and COVAX. I have a bit of an idea of some of the problems that were there. There are equity issues that are very dear to our heart that I tried to overcome in what I could do in practical terms in the pandemic, because there was simply no time to fix everything that was wrong. There were a lot of things that went wrong that are maybe not so obvious to the general public, that have nothing to do with greedy nor sitting on the vaccines and not willing to share with everybody. However, I have also experienced very tough discussions inside our government at the beginning of the crisis, where there was an extreme national security pressure. And if you are the Chancellor of Germany, the first thing you do is make sure that you look at your citizens. If not, you're going to get kicked out of office. It's simple as that. And I think I have never experienced that beforehand so strongly, how desperate also politicians were to actually serve their own population. And there's in the first sentence, there's nothing wrong with that. I just wanted to make sure there's nothing wrong with that. And it would be totally naive to think that in the next crisis, this sentiment will go away. You can have that maybe in a dictatorship, but in a democracy, it will not be possible. And I think it's the right thing. So the question is, then what? I think at the beginning of the pandemic agreement negotiations, I come back to the TAPS thing also, the Europeans put a proposal on the table, and we were not into this tit for tat thing. You give me the pathogens, I give you the vaccines, which I also think it's quite a questionable approach, but okay. We basically put upfront as European Union together, say, this is our offer in the next pandemic, besides also other things, let's make sure that a portion of the production is set aside immediately from the beginning and is distributed globally, purely based on needs. And we're basically laughed at from the room, including from Brazil. No, we don't want that. Charity, don't want this stuff. No. So just to say, there are also different interests in the room, and there's still a difference, I would say, between at least developed country in Africa, Brazil, and Germany in terms of capacities to deal with the pandemic. There are differences. I was involved in COVAX, and I remember very well, let's not forget that the first vaccines in COVAX were more or less delivered at the same point the first vaccines arrived in Germany. There was no, the first Germans were vaccinated when the first shipment came to Ghana and Cote d'Ivoire and others. And then for some reason, just to also put this very bluntly, for good reasons also, one of the main producers decided that they have a national security issue and they cannot send any vaccines anywhere else. And this was not Europe. Also in Europe, it's not like every country in Europe has the capacities to produce all this stuff. This is quite limited, and also it doesn't make sense to have every country produce this. So regional markets, regional cooperation is really, really important. Germany, so to say, step back from the agreement a bit, the German system favors looking at Africa first. Yeah? Our Ministry of Economic Cooperation, they have the big money. It's not the Ministry of Health, it's not the Foreign Affairs, Research. The big money is with the Ministry of Economic Cooperation, Development Cooperation. And their focus is Africa. So I'm quite proud what we have started in Africa. Germany is not so good in marketing, but all these programs, if you look at building up capacity, regulatory cooperation, mechanisms to actually ensure that the local produced stuff has a viable market case, it's all heavily politically and financially supported by Germany. Now I'm very proud that I think Spain took the initiative to broaden this beyond Africa, and as you have mentioned, start similar efforts with Latin America. I think that's very useful, but I can still see it's not easy. I think from the beginning myself, I have been trying to push this agenda. Difficult to get through in the German government on this, because we somehow tend to fall between the economic cooperation, purely private stuff, and traditional development cooperation. So we have to do more efforts in the German system to work with Latin America. In general, and I'm sorry if I started to ramble, I think the only viable thing really is, as you have said, research cooperation where makes sense for both sides. So no charity. There must be really an interest from the side from a German research institution that they actually want to get something themselves out of this beyond just because there's a fund available. Same goes for industry cooperation. There is, and I remember I was on various also with Fiocruz in various closed settings, and I think at least in these settings we saw totally eye to eye on that. The idea that we can tell a German company, you guys go to this country and you produce there and for this price and this product, that's not how it works in Germany. So either there's a business case and the right environment and the right incentives, then it can work, but a top-down approach on this will not be sustainable. And last thing, I think we were quite lucky in this pandemic. I could brag on now. The first test came from Germany. The vaccines came from Germany. We still had production capacity in Germany to produce something, but we were lucky. Can be totally different in the next pandemic. And also we were struggling at some point when other countries shut off their supply chain. Basically, I'm not an expert, but there were, we had BioNTech had for a few months a big problem to produce their mRNA vaccines because the country where they got the lipids or whatever from said no. So we have realized in the pandemic also how vulnerable our own supply chains are. And we also think that in a global system of solidarity, next time it might be us who actually need it. And this can only work if this is a shared endeavor and everybody contributes. So I would expect, for example, let's put it very bluntly, let's say the next pandemic and somehow the only vaccine that works comes from Brazil. I would expect Brazil to join the system and share as well with everybody else. And there sometimes in the negotiations, and I don't want to single out Brazil, but in the negotiations when diplomats sit around these arguments that maybe I hope make sense to you, doesn't necessarily make sense there. It's a bit of parallel to the climate negotiations, where you still have countries, you would say they have more billionaires than Germany have, who say we are a poor, least developed country and there is no way where we're going to allow to be treated differently. So sometimes it's a bit absurd, I think. And I think it would be fatal to drive away the researchers and the industry from actually working on pandemic products, because that's what I'm getting to hear from industry. Well, maybe they're lying at me, but I have the feeling that German companies or European countries are starting to walk away from that market, because it's not a very attractive market if there's not a pandemic. BioNTech, they are not performing well at the moment, and so it's maybe much more lucrative to have stuff that slim, because these injections to get slim or against cancer or something that can make much more money than with working on keeping structures warm to research pandemic products. I have been talking a long time. I think it's good to realize and that we agree all these. I come from the Foreign Office, International Department, United Nations, multilateralism, that's our thing. But don't expect too much of that. It cannot solve, this top-down approach cannot solve everything. It's the same in climate. I was in the climate negotiations, and we really tried to ram this top-down approach through, and we failed miserably in Copenhagen, and then I went on to work other things, and it took a while before we came back with a new approach, and this was more of a voluntary bottom-up approach than this strict top-down system. We are not anymore in a geopolitical environment where this works, I think. So be a bit humble. I think we are trying to be humble, want to make a contribution, but this cannot solve all problems. And then we can go on and on about IP parts, what have you, but I think I should stop. Thanks.
Well, thank you. I mean, we are very much privilege to have somebody speaking openly about the process, and I think in this room you will find many people who appreciate the role that that our government and that you and your colleagues are taking. Before I hand over to the left table of the round table, I would like to introduce Ciro Ugarte from PAHO, who has joined us. Thank you very much for joining our roundtable. Thank you. Maybe you could briefly present yourself, and I cannot just to give you a mission, Ciro. So presenting PAHO has been mentioned repeatedly. This is a consortium meeting. This is a symposium where we try to find common ground in health between EU countries and institutions and projects and Latin American counterparts. Maybe you could describe how you see the role of PAHO in accompanying or even leading processes related to this. Thank you.
Thank you so much. Let me apologize for joining you this late to this session, because our member states, the executive committee of PAHO just approved a resolution on a strategy on epidemic intelligence to early warning of health emergencies. There was a long discussion, but it was approved, just approved a few minutes ago. I am Ciro Ugarte. I'm the director of health emergencies at PAHO. And I was heavily involved in, of course, in large emergencies, but also on COVID-19. And there are several aspects that the former speaker just mentioned, and I would like to highlight those aspects. And there are several areas where we must be proud of the joint collaboration between European Union and the Americas, particularly Latin America. You highlighted that, for example, the tests. Okay, we used the tests that were produced in Europe, and all Latin American countries used those tests. We didn't use the CDC tests because many reasons, but one of them was the availability of tests. But also, I would like to highlight that the health systems and services in the Americas are better prepared. We can say that they are looking at more strengthening their capacities, but also identifying which are their shortcomings, and that is extremely important. But this is a long process. We cannot just change the reality from one emergency and then say we are better prepared. There are several issues that we are facing right now. I mean, common sense approaches, for example, infection prevention and control, is not being followed, unfortunately, in all health systems and services. And that is a big problem when we are dealing with pathogens, particularly emerging or re-emerging pathogens. We are still struggling on early detection. Sometimes the open sources or other sources of information are not taken into consideration because we are so interested in formal or national led information, and sometimes we miss the point in several areas. We're dealing big time with that. And the other part is how can we strengthen that collaboration? We were grateful for working together with the European Union, particularly Spain, at the early stages of the pandemic. And we exchange on for example, the clinical management, the early detection, how we can deal with the increased number of patients, but also how can we deal with the lack of enough personal protective equipment for our healthcare workers, and many, many other things that we did together. And we still value that collaboration, and we must strengthen that. But during the pandemic, the region of the Americas suffered a lot for two reasons. One is the high inequity that we have in the region of the Americas. That is unfortunate how it happens, and how the transmission was exponential in several areas. Not only Latin America, you recall New York, you recall Guayaquil, you recall in Ecuador, Loreto in Peru, and several other areas where we had disaster zones during the pandemic because the exponential transmission and also overwhelming health systems and services. At the same time, that our healthcare workers did not have access to essential personal protective equipment. We depended 92% of everything that was used in the Americas was produced outside the Americas. So we learned those lessons. We have now an initiative that began 2 years ago, but now it's formally established, a joint effort among member states like as partners to produce medical countermeasure products, including vaccines, supplies, equipment, and so on. Because we cannot afford having another large emergency, with the global supply chain collapse and also the privatization of those supplies or vaccines at the countries that they are producing that. That's how it happens. So we are dealing with that. But still, we think that there is a lot of opportunity for technical exchange, for establishing these networks of experts. And we are very closely monitoring several emergencies. And if you go to the system of information system, a part of the IHR, but beyond that, you will see that in the Americas, the information exchange is increasingly transparent. And it is something that we must be proud of. And I think we must also look for how can we sustain that collaboration. It is not a good color to mention, but that collaboration may need essentially the commitment of the member states, the national funding, and a complement from international funding. And I think that everything that we must implement together must come, in my opinion, through a EU-LAC funding mechanism that may benefit from the member state support, but also some other international donors. Otherwise, we will be just talking about what are our shortcomings and what are our interests, but maybe we cannot move forward. And I would like also to highlight, my last words is to highlight that it is a commitment of working together. That is the main commitment. We cannot go on our own. Unfortunately, that is the reality also. The ministers of health must prioritize their own population. That's how it is. And the chief of state must prioritize their population. That's how it is. But looking broader, we helping other countries, we also protect our own population. And that's the twist that we must do. Otherwise, the politics and all the impact and the communities will say that, okay, our leaders are, privatizing another country and not us. And that cannot be that way. So one part is the communication, the information, but also highlighting that we are in this world together. And in that regards, protecting the least served populations, particularly when there is an initial outbreak at that point. It is better for everybody to stop that at the source. And we must work together in that regards. Thank you so much.
Thank you, Ciro. Very important comments. We have a few words from the audience to you. Is this the only? You have another one. Thank you. I think Daniel, I saw Daniel's hand. I don't know if Bogi or Daniel was first. So Ciro, while the microphone is passed, this is a first comment from my side. I completely agree. Felix Drexler from Charité Virology. Hi. Completely agree with everything you say. At the same time, it's Martin from the German Ministry of Foreign Affairs has a negotiator from the pandemic agreement for Germany has highlighted that he is proud of our government's investment into international cooperation, and also correctly, in my opinion, highlighted our traditional focus not on Latin America but on Africa. It is what it is. As a professor, I have handled millions of euros from that ministry, the BMZ, contributing to Latin America. We have donated kits to PAHO in Venezuela when it was hard to even work with them politically, openly, accompanying diplomats from the Foreign Office. So, this all happened, but at the same time, I'm still trying to work with that German ministry for health-related issues in Latin America, and it is becoming very, very difficult. Our government is not in a financially very comfortable situation for many good reasons, which you are all aware of because your governments are in exactly the same situations, most of you in the room. And one of the things that is frustrating to me, it's maybe more comment than a question to all the room, is that health is now not becoming a fundable issue from this very German ministry. And the GIZ, which is the German Agency for Development Aid, is hearing from BMZ, which is the German government funding over 90% of their budget. And as Martin has said, this is where German taxpayer money is actually present in reasonable quantities, is that, no, you got enough during the pandemic. Now we fund other stuff. Because our funds are limited, we have to focus. And I'm not saying it's a wrong argument, but as a health actor, it is frustrating to hear that, and there's not much we can do. Health was not an eligible aspect, an eligible pillar for German bilateral cooperation in the Americas. The pandemic changed it in that it has become an additional pillar during parliamentary negotiations, but now we have no money left. So it is eligible, but there's no money. Our minister visited Colombia and Bolivia straight after her election, after she came into power, not straight, but very soon afterwards, and was very impressed. Some of the people who impressed the parliamentary the delegation are in the room. And still times are changing, and it's not easy to keep up the interest into health, unfortunately. It's a comment from my side, just to follow up on Martin. Daniel, over to you, and then Bogi.
Yeah, thank you very much, Felix. Yeah, I agree fully with you. I think we have a short memory, and we will forget very soon the pandemic. That's my fear. So I have to say that so in the vaccine field and in the therapeutics in general, charity does not work. As Martin mentioned, it's impossible to convince a biotech company to transfer the technology to another country just because of political will, and the government cannot impose that. So we have to find a way to make the vaccine and therapeutics and the diagnostic production in Latin America sustainable. And it can be sustainable. So we have to find a way. I insisted in that in the morning. We have to find a way to give priority to technology transfer and to build vaccines and therapeutic factories in Latin America, regardless if we are in the middle of a pandemic or not. Because those factories, it doesn't matter the factory is old, it is 10 years old or 20 years. That factory, when the factory is there, when the people with the knowledge are there, in the middle of the pandemic, we are able to shift it very easy from producing an hepatitis B vaccine, for example, to another antiviral vaccine, thinking in any other viruses that can come in the And Europe, at some point, will have to find a way to motivate European companies that the production of therapeutics and vaccine in Latin America is because Latin America is a huge market. But because what we are not still thinking is that China, and I will be very realistic, China has not still jumped into the biotech field so powerful, but it can do it in 10 years. And when they do it, perhaps Europe loses much of the influence or much of the great business that still you can find in making technology transfer, investment in biotech production in Latin America, not as a charity, I agree with you, not only as a solidarity, because solidarity works for some purpose in the middle of the pandemic, but we forget it very easy, but as a business. And the goal of my message here, we have to find a way to make this an investment sustainable, that to find a way that the business is attractive for the investors. We have, and the governments, the governments can, of course, favor soft credits, for example, something that if you are building a vaccine factory, you cannot expect that a year after you are returning 20% of your interest. You have to give soft credit. You have to give perhaps government credits, which are very soft, with a period of 10 years, 5 years, to start returning the interest. You have to favor some technology transfer by investing in human resources, formation, in capacity building, or something like that, to keep the people working in Latin America with the capacity to produce vaccines. It doesn't matter if we are able to produce, if we are producing now other vaccines, because once the production plants and the people are there, we can ship it very easily. And saying that, we have to make the technology of messenger RNA vaccines available to the world. But we cannot say to biotech to release the patents to do so. This is impossible. It will not work. It will happen the same with the AIDS. So we have to invest on technology transfer, on training people in Latin America, so that in 10 years, perhaps we are able to develop our own messenger RNA vaccines, because this is a technology that is able to produce a vaccine in a very fast period of time. So no other, perhaps the inactivate vaccines is technology that also can produce, but we learn from some vaccines that they are not so efficacious. The efficacy, the clinical efficacy is not as high as in the case of the messenger RNA vaccine. This technology that Latin America does not have, has no way to acquire that technology unless we invest in technology transfer and formation of human resources. I insist on this. It's not to build factories for filling vaccines, European vaccines in Latin America. I think we have to invest in technology transfer and invest in the future and realize that this might be a good business for European companies. And only that way, only the European Union that way can favor that there is such an investment in Brazil, in Colombia, Argentina, in Mexico, in the big countries, in Cuba also, although it is small, because in 10 years, the big Chinese market can start to look now. They are looking more mining in Latin America, more technology, more microchips. They are looking at other things, but they will start to look in biotech products with such an impulse that, and they are very fast, we know there, and then they will start to look at the Latin American market there. So we have to look at this as a business, as a cooperation, but also as the possibility of making money there, and then we can perhaps convince the companies to invest in Latin America. But they have to look to see as a business, because solidarity and charity, in my opinion, with my negotiation, where I have been in negotiation, it doesn't work. It doesn't work, it's my opinion.
Thank you, Daniel. Do you want to comment, Michael? Because I hold the mic.
Yeah, thanks so much. I just want to quickly talk about the equity and how to get there. I mean, I would even argue that maybe, at least at the onset of the negotiations, like equity wasn't like the central point. That it was in there, it was important, but it's not just about equity. And some like people would even argue that it's today still not only about equity, and like setting aside the functionality of all the norms that are in there, and the PUBs, and what comes with it, the scientific evidence that it might not be a good mechanism after all. And I'm a scholar of international law, so I don't want to have this like very easy argument of at the end it doesn't work at all. But let's be pessimistic here and like think about the case that you just made. When the next pandemic hits, and let's say France signed the pandemic agreement, it's ratified, and the pandemic hits, and a vaccine that is developed and produced by France is rolled out, and then the French government, let's say it's a center government on the political spectrum, says to its population, no, wait, 20% of everything we produce has to go abroad. We cannot use that for you. You are in need of vaccines, but we cannot distribute it because there's this pandemic agreement that forces us to share a certain percentage. Let's be honest. Is that a realistic scenario? Will that happen? I hope so, but I'm very pessimistic about that. What could happen at the end, or what might work, is, and you just eloquently put that, economic cooperation, connection between regions and companies, not only having one French pharmaceutical company that from like the starting material to the finished product produces everything, but a supply chain that also makes a business case for several countries included that makes them refrain from imposing restrictions on the production, because at the end it will hit them and it will violate economic interests. And I mean, it's a perverse game, but we live in a capitalist society, and this is how the corporations work, right? And also how countries work. So I would argue that fostering this economic cooperation, interregional cooperation, business to business facilitation is crucial. And the EU has to consider 2 points that I want to make, and I'll finish with that. First, when we want, if we want to diversify our production, we have to, let's say, sacrifice this idea of reshoring everything back to the EU, let alone that it won't work because it's too expensive. We have to accept that certain countries, certain interdependencies will exist. And that's a good thing. It's not bad to have interdependencies, because then one will not, let's put it bluntly, screw the other, right? And second, the EU will have to accept higher prices for medicines at the start, because currently we have strong economies of scale, comparative advantages in China, in India. And if we want to diversify away from that, if we want to strengthen local production in other regions of the world, in Latin America, of course, it will be more expensive. Like, how could they compete with Chinese production? And we should not make the same mistakes that other countries did. I want to now pick out like South Africa that said, oh, we have this now super nice vaccine production company here in South Africa. They are producing locally. Oh, wait, the Serum Institute in India, they're much cheaper. Let's buy from them. Like, what is that, right? So the EU has to internalize the fact that if we want to diversify production, it will be a little bit more expensive and we will create more dependencies, but that's a good thing.
Thank you. And that comes back to a point I normally raise. There's a difference between value and money. Money is a part of value, but all value is not money. And this goes also back. Can you hear me? Yeah. So it also goes back to that when you want to work with pandemic, it's about resilience. And going wrong on resilience can be very, very expensive on that part, which we have seen. But I would like to go very fast on that. I think we are mixing emergency with development. It's not the same thing. So buying the fish and teaching how to fish is not the same thing. And I think that's very, very important. So emergency does not give development. I think there is a lot of literature on that. So just to push that. And I do work quite a lot with companies. The challenge in Latin America is on the uncertainty. It's not necessarily that it's slow, but you need to know how does it work? How long does it take? Right? I also work. We are co-developing a new concept for clinical trials that we call Phase 5, which is decentralized and digital, where we are right now trying to see if we can establish this in Uruguay. And this you could go across all of Latin America with, for instance, rare diseases quite fast, especially when you only work in one language. So these are things you can do, but other companies are already in Latin American clinical trials in some countries which are very stable because you get much more for the money. You have a high expertise in some countries and it's much cheaper to do than in Europe or in the States. So what I'm missing, and this is not just a Latin American challenge, it's also a European challenge. What is the playing field you as a country accept? Because we are being overrun by digital companies and pharma companies and the combination of both. And we are not saying what is the social contract and the social value and the solidarity we want in health. Nobody is doing that. And if we are not doing that, we are not getting the system that we want that is resilience and has the fairness. So this is much more than just about a contract on where do we send them education when we get hit the next time. It's really about the ground principles, the dignity in the society, and no treatment, no treaty is going to solve that by itself. The World Bank is putting back forward again this old concept of data intent. So if you have data in the system and it has public value, you cannot just sit on it and lock it in. It has to be used. It doesn't matter if it's public or private. And I would also question the understanding in the room that there is no money in Latin America potentially. There is a lot of money in the World Bank. There is a lot of money in the IDB. There is a lot of money in different parts. They are even coming forward and saying we can't get rid of this money because we don't see the projects that we believe in. So there also needs to be a reflection on both from the European side and from the Latin American side and saying, okay, if the money is there, how do we do it? So the question is not the what, it's the how.
Can we have the mic?
Yes, of course. Hi, my name is Julieta Rojo. I am from the scientific advisor from the Mexican Embassy. I'm not a diplomat, I'm a scientist. I'm a medical doctor, and I have followed the pandemic since I arrived in Germany. This is the only embassy from Mexico that has a scientific advisor like me. I'm an experiment. Okay, I was wondering, you have been talking about health the whole day. Nobody talks about patients, only my colleagues from Spain, from Ecuador, because where is the impact from all that you have been talking the whole day long in the persons? I think, first of all, we have to fortify our health systems. For instance, during the pandemic, all the patients were forgotten. I mean, it was only COVID-19, and patients for surgery, cancer patients, neglected diseases were forgotten. Everything was forgotten. So if we want to be really prepared for another pandemic, and I don't think we will be prepared for nothing because we don't even know what it's going to be like this. You're talking about vaccines. How do you know which virus or where does it come or where is it going to be the first one, the first country? We don't know. We cannot be prepared, but we can be prepared if we are prepared to attend the patients that we already have. And you were talking about the model, another type of project, because I've heard a lot of business, pharmaceutical, vaccines, money, and things like that. If we really want to develop, because we are developing something, let's start with a different model. What kind of model? I have been talking to Felix since I arrived in Germany. A model in which you can research. You can have a platform of epidemiology dates, and you can attend those peoples that are identified in these zones, for instance, vulnerability populations, like populations like Southeast Mexico or Central America, like neglected diseases, because they have to do with migration. They have to do with zoonosis. They have to do with climate change. They have to do with vulnerability. So let's try to have a model when you can see what are you working for. We are working for people. I mean, it's only a reflection. I had a lot of information for you, but I was telling Felix, I have this feeling he's working alone in his institute, virologist, and to make collaboration, to transcend, we have to really work together, cooperation, but together in a center, together communicating, not research. We have also in Mexico direction of epidemiology. You can have all the dates, and what do we do with that? I know how many people are ill with neglected diseases in which states of Mexico and whatever and so forth. And well, I propose a lot in my times when I was a clinician and when I was a researcher, and I had a lot of success doing manuals and things like that. And I talked to politicians and I had a good response. But this is only a reflection and a proposal. Thank you very much.
So we have now a few things. Vladimiro from Colombia wants to comment. While I bring the mic to Vladimiro, Ciro, can I briefly ask you to reply to Julieta's comment from your perspective, and then to Vladimiro, and then we have to close the meeting because some of us have to catch a flight. So Ciro, over to you.
Yes, of course. Thank you so much, because those comments hit home, okay? Because there are many aspects. I would like to also mention that when we are talking about equity and solidarity, and actually those were the first victims at the beginning of the COVID-19, okay? The first victims were solidarity and equity, and they are still the victims when we are planning for large events. Okay, we're talking about extraordinary measures for extraordinary circumstances, not necessarily the business as usual. But yes, I would like to highlight that there is an important aspect of prioritizing where we must invest, and not having, in my opinion, only the interests at the level of economy, financing, or so. The interest is the well-being of the population. And when we discuss, for example, we are talking about the One Health approach, with all the health systems also involved, with the agriculture, the animal health sector, but also the private sector. And when we look through those lenses, usually there are several different opinions of what we must implement. And for example, just to let you know that we had a meeting in Rio de Janeiro with many member states in the Americas, including Mexico. And Mexico coming from the agriculture sector, Ministry of Health, and also financing. When we are talking in the different perspectives of the sectors, they must have their own priorities reflected in what we are agreeing. And the best approach that we found, particularly on the health services approach, but also in the multi-country, is that an agreement of the countries being as partners, not as beneficiaries. We're talking about partnership, but actual partnership in the production, for example, of medical countermeasures. They are part of the production, they're part of the research, they are part of the information exchange, they are part of the supply chain, but they are part of it. And being part of it, they will leverage and they will have a better outcome on those agreements. And I think when we are discussing with all the member states in the Americas regarding their capacities, particularly the health systems and services, we must prioritize what may make the difference. If we invest in everything, we will not change the reality. We will fail ourselves. And you may also heard this quote that coordination is a very nice word. Everybody wants to coordinate, but nobody wants to be coordinated. And in that regard, we are dealing with those issues. I mean, taking the perspectives of each of them is part of the key solution that we must look at, and we will fail if we don't pursue. Thank you.
Thank you. Well, my comment is going in the same way by Dr. Ciro and the colleague of Cuba. I am really afraid to see how the European community and also Germany are losing a lot of opportunities in Latin America and over the world. Just with the discourse, yeah, we cannot do it because they do it cheaper or they don't follow the ethical rules or whatever. Examples. Many of the highways now in Colombia are doing by Chinese companies. The new metro in Bogota are doing by Chinese companies. Why? And I asked at the guys that are coordinating the construction or the building up of the metro in Bogota, there are any European company that apply to the building up? No one. Zero European community companies doing the highways and so on. You lose long time ago the race of building electric cars. Chinese is going really far, and now you try to impose like taxes just to prevent that it's invading America and invading Europe. What is going on? The politician, you don't need really to study a deep politician studies to understand how it's going the economy. And the politicians here in the European Community are really sleeping and don't do anything to try to prevent all this kind of stuff that are occurring in the geopolitical stuff. All the Chinese are colonizing all Latin America, and they are looking Latin America as a business. And still Europe is looking as a helpers or doing any kind of favor and don't doing the potential business that are doing. Probably in Mexico is working fine because they have America close. But if you look Tijuana is full of now Chinese companies. And they know that they have to be close for all the taxes that are imposed in America. And in Brazil is going the same way. Full of Chinese, all the companies are there. European Community is losing a lot of opportunities.
Okay, Vladimir, thank you. I cannot let that as last words. It's too critical. I will ask with a question, and I'm not sure to whom. So, does South America, do we need a Latin American CDC? And I will ask somebody Bert, I will ask you. You are a political scientist, and you've heard a lot of people not from the social sciences speak today. So what's your impression? Can you close this? And that's the fine. There's no other comments, people. I'm sorry, Bert's word is final. And then it's drinks and wine. Thank you.
We didn't script this. I mean, it will be up to the Americans to see what they need. I think many of the Americans here saw a big need for increased cooperation across borders in Latin America. If that takes on the form of a CDC, someone said Latin America-wide CAPA, whatever, I mean, it could take on different forms, but it will not be easy to get, and that would be a question we could have to Angela, I mean, or to GIGA, how do you get governments that are very at odds politically into a project that still works together in Latin America? I mean, between Milei and Lula, and it's not easy to find common ground to get any new initiative of that size easily off the ground, I would say. So I'm a bit skeptical that we would have one organization created and new out of nothing very soon. But I think there's a big quest to integrate better, to cooperate more than in the past. And that I think we've heard from quite a few speakers today. And that will take on different forms. It will not be one big splash bang invented, but I think we will see a lot more, and we've heard that. That would be my answer, that we will see rather many smaller movements, but not one big one. But it's up for others to implement any of that, and best wishes to everybody. And thank you once again from my side, also for everybody participating, those who came from afar, those who joined online. Mr. Ugarte, it's a big pleasure to have you here. Special thanks to Mr. Bergfelder, who has to run off now quickly. He told us that before, but thanks a lot for Mr. Bergfelder. Thanks a lot for supporting this project with the front office partner. Thank you. I hope that you enjoyed everybody else, please enjoy the light snacks we have prepared.
Thank you very much. I would also just close this symposium. We have talked so much that the normal microphones did not catch up with all of our dialogues. I think this speaks a lot. First of all, thank you very much to the translators who are with us all the day. You have done a great job. Thank you, Ciro, for connecting. We know it has been an important session that you were in, and thank you very much for making it possible to have you here. We really appreciate it. Also for Angela Hinz, who is still with us from CARPA. As the next, also to all of you, of course, who came, who made the time from really remote places to be here in person. We really appreciate it because there's nothing that can substitute these kinds of encounters and dialogues. As an entering step, we will be publishing all of those sessions in our YouTube channel so that it is available and accessible for all those who could not follow us directly today. So, and you will be invited to share it, of course. And then we will jointly with the brain power of Felix, of Bert, and also the colleagues from ES Global who just had to leave. We will produce a policy brief, which will be a sort of resume from all of what we've heard. It will be quite difficult, but I also think there has been so much quality to all of your interventions and presentations that it should be really shared among political decision makers, among scientists, among civil society at large. And we hope that some of those messages get through to those who really should listen to them. Thank you very, very much on behalf of the EU-LAC Foundation.